a very intricate story. And I'm sure at the end of the day, some of us will understand why we need to respect our mothers, why we need to honor our sisters, and why we need to show them intentional love because it's not easy. So if you're a woman here, I want you to give a round of applause for yourself. Prof. Prof is online. Prof, you're welcome, sir. If you can hear me, you can just unmute and say hi to us. Prof, can you hear me, please? I want to be sure that Prof can hear me before we start. Alright, without wasting much of our time, I would like to call on the host for this event. A round of applause for. I don't know, I just. Why is it making me hate? No. But let me please, can continue. Alright, please just permit me, please, just forgive me. Yes, I want you. Thank you very much. Alright, without wasting time, I'd like to call on the district governor to call this meeting to order. Please, let's clap.
Good morning, ladies and gentlemen. I recognize all the women in this hall, and it's a program basically addressing the needs of women. So I'm not surprised that we have more women here than men, but I also give recognition to the men in the house. Because without a man, we don't woman, and without a woman, we don't man. So men and women are made by God to complement each other. At exactly 11:15, it is my pleasure to call this meeting to order and recognize the district doctoral representative, Dr. Ismail, and I recognize our special guests who are here with us, and I want to thank everybody who are here for this Gynecological Health Summit. So, please let's be outstanding for the closing grace. O Lord and Giver of all, we praise Thee for our daily food. May Lord refresh and Lord we praise, help us to serve Thee all our day. Thank you, Mr. Let me make some few remarks. Maternal and child health is one of the 7 areas of focus of Rotary International. And any activity or any issue or anything that affects mother and child, we take it very seriously in our organization. Our intervention in the health sector has been very impactful, very productive, and very relevant to the needs of our community. So it is no surprise that this morning the Rotary Club and Gynecology, in collaboration with an organization that deals with issues affecting women, decided to come together and bring this up. I know that a lot of things affect our mothers and children. Maybe issues arising from birth complications, bleeding, or any other health challenge. But as I always say, as Rotarians, we are people of action and we are problem solvers. There is no issue of life that Rotary
Recording in progress.
has not intervened in and has not successfully resolved, which means that whenever we intervene in critical areas of human endeavors, we always want to find a solution. Hiring of medical experts that we have here, I believe that they will do justice to the topic of the day, and at the end of the day, all of us experience from their expertise and immense knowledge. Once again, I welcome you all to this program, and I want you to please enjoy the program and let us all learn together so that we will be better in it. Thank you very much.
Thank you very much, Ms. Sandri. Thank you very much to our distinguished Rotarian, Mr. Larry Abedoni, for that opening remark. Is it echoing? It's okay? All right. Okay, so it's a pleasure to be here. Thank you for allowing us to have my Gynae Issues Foundation host this summit here in Rotary. Just to let everybody know, this is the Gynecological Health Summit 2026, co-hosted by my Gynae Issues Foundation and by Rotary International District 9112. Welcome everyone, and thanks for your patience. It's going to be a very exciting morning. We have a fantastic lineup of speakers, experts, professionals, and those who have experience personally in this field. So it's great to get you on board. I would like to, without further ado, introduce you to a very important individual. In fact, he is the chairman of my Gynae Issues Foundation, Professor Rotimi Jaye-Simi. And please, just before, because I know we want to clap, let's just talk about profile of it. So he's a 1978 graduate of the University of Ibadan, and he was appointed consultant in obstetrics and gynecology in the UK in 1994, the first Nigerian to be appointed. Professor Jaye-Simi is currently the Associate Medical Director for Patient Safety at Basel University Hospital, Essex, and is a senior professor at the Faculty of Law, University, a senior fellow of the Faculty of Obstetricians and Gynecology. He also holds a master's degree in business administration from Newcastle Business School and a master's degree in medical law from Northumbria University in Newcastle. Professor Jaye-Simi is a transformation agent with a vast wealth of experience in clinical care for all the Nigerian policy, yes, on gender and health.
Good morning. Standing on existing protocol. Can you hear me? Lovely, thank you. Just to give my thanks, appreciation to the Rotary Club for creating this platform to collaborate with you for the Gynecology Health Summit. I was delighted to hear Rotarian Adedoyi when he said, I think he said that without mothers or without women, really what I would say is without women, life will not exist. Society will not exist. So it is very important that as a nation and as a society that we ensure that we care for our women. And caring for our women doesn't begin when they become women. It starts from when a baby is born, a female child is born, all the inequities that exist in terms of education, health, access to health, shouldn't be, because the disparity does affect the health of women. So we will be advocating that a girl child is equally as important as a boy child. There shouldn't be any difference. So as a society, we must accord our girls, our children, female children, all what they need to grow and develop, because they are the future of our society. And we also have to be mindful or knowledgeable about the economic benefits that women bring to society, whether they're housewives, staying at home, looking after the children, it has its own economic benefits as well, or whether they're chief executive of boards, it has its own benefits. And really talking about gynecological health, it does start from infancy right till the end of life. That span is very important, where women are exposed to many conditions such as endometriosis, fibroids, heavy bleeding, painful periods that women, men as men, do not appreciate or go through. Not to talk about pregnancy, having a baby for 9 months, breastfeeding, looking after children. So there is a lot to talk about today, so I'm going to keep it very brief as we speak. So this is just to say, welcome once again to my Gynae Issues Foundation Gynecology Health Summit 2026 in collaboration with Trophy Club 9112. Thank you, and we look forward to a very inspiring and thoughtful discussion. So thank you.
Okay, Professor, it's a pleasure to meet you once again, everyone. My name is Israel, and we'll go back to Professor. Once upon a time, in a very special country, the girl child was looked at as not quite second citizen. It was a world where men were at the forefront of events until the awareness came and the girl child was celebrated. But let's take this scenario. The girl child decides to study, gets into university, gets a degree, starts working, gets married, which we all love. And she also wants to have a baby. But how will she take care of her health? What will she do? What are the challenges? Amina is in the village. And she likes to work. She goes to the farm, and it's traditional marriage. She has to get married at a certain age. She stops at farming to be given to a man in marriage. She's not aware of what it entails. She's happily married, but now she's pregnant. What will she do? How will she take care of herself? Who will educate her? Meanwhile, she's at the village. No exposure to nonsense. What will Amina do? These are the questions that the female girl child has to go through, and that's why we're here today, to empower her, give her the necessary knowledge so that she will not be part of the statistics. We know that in Nigeria, the mortality rate is really alarming. Out of every 1,000 or 100,000 that give birth, over 1,000 die at childbirth. 1,000 women. That is the total loss to a nation. So we must stop it. And how can we stop it? When we come to have such programs here at the Gynae program, we educate We educate people on how they can take the next step in transforming lives and saving that woman. We know that when a woman is affected, the family is affected. So today, we'll be taking you on that journey to empower women to stay alive after obeying the natural course of nature. Welcome again to this wonderful program. Without further ado, we will be asking Professor Jellicine to take us on a topic, importance of early prenatal care, essential screening every pregnant woman, essential screening for every pregnant woman, and the preventive causes of complication. Professor, please, could you take us on the importance of early prenatal care? Thank you very much. Put your hands together for Professor.
Yeah, thank you for, again, that kind introduction. Talking about pregnancy, people consider pregnancy to be a normal process, but as we've heard this morning, 1,000 in 100,000 women die during childbirth, which is very bad. Women should not die while trying to bring life, new life into the world. That is not something we want to happen. And that's very common in Nigeria and in low to medium income countries. Whereas in the Western world, the figures are not as abysmal as what we have in Africa. And that is why we want to address these issues. Now, it is important that women, before starting a pregnancy, are in good health. And when I say in good health, you want to be in optimum health, ensuring that your blood levels are normal, that is, your blood count, you're not anemic due to either malaria or worm infestation or poor dietary needs. So you have to optimize your health before embarking on a pregnancy, and that's prenatal care. And from the nutritional aspect of prenatal care, one of the aspects that we also advocate is how do we prevent neural tube defects. Neural tube defects are conditions that can affect the spine, where there is a defect in the baby's spine, and that can affect the baby in terms of bladder function or function of the limbs, or even development of the brain. So women are advised that before you embark on a pregnancy, once you start contemplating that you want to have a baby, that you should start taking folic acid, which you take until about 13 weeks of pregnancy. That reduces the risk of developing neural tube defects. In addition to that, I would also recommend that because of the prevalence of anemia in our society, that taking multivitamins, perhaps the one specifically manufactured for pregnancy, women should also take that. That will ensure that their blood level, their hemoglobin, is optimum before pregnancy starts. Because in pregnancy, as pregnancy advances, and as changes occur in the woman's body, there's going to be a dilution and a reduction in the blood count of women. So prenatal care in preparation for pregnancy is also very, very important. Another aspect that I will make a little bit of reference to is knowing your genotype. That is, are you hemoglobin AA or AS, SC or S or AS? This is important because, again, people do not want to bring into the world children who will suffer from sickle cell disease. Well, it's not an absolute necessity, but it is advisable that before you get married, you know your hemoglobin, your genotype status, and the genotype status of your potential husband. And again, I don't want to dwell into that because that's ethical, there are ethical aspects to that, there are religious aspects to that. But it's just to bring it to the fore that it's good. Apart from the marital and having children aspect, if a lady is SS, they will be anemic and it has potentially serious problems during pregnancy. So it is important that you know what your genotype is before you start a pregnancy. Now, when a lady falls pregnant, it is important that we know exactly when the pregnancy started. That is in terms of dating the pregnancy. I think things are better now with the presence of multiple apps that you have on your phone that you can track and monitor your menstrual period. Many, many years ago, in the 80s, or even in the 70s, when women, at least in Iran, I can speak of that, were asked about their last menstrual period, they would say, oh, let me ask my husband. But I think we've moved far away from there, where women have to depend on their husbands as to when their last menstrual period is. Now, the importance of knowing your last menstrual period, as well as how long your cycle is that it helps us date the pregnancy. But that's a subjective aspect, because like I said, most women perhaps do not know when their last menstrual period was. And what we now have is an ultrasound examination done at about 8 weeks to 12 weeks that accurately dates the pregnancy. So we can tell how old of the gestational age of the baby, and in doing so, we ensure that the baby does not grow past 42 weeks. Because if that occurs after 42 weeks, the chances that that baby might die is important. So it's very important that you book for antenatal care in a good health facility. One of the things I was told, I was in Nigeria not too long ago, I was told women will go and book in a reputable hospital, either government, either teaching hospital. But after they have been told that all is fine, your baby is okay, you don't see them come for their delivery in hospitals. They go to faith-based centers or traditional birth attendants, where when things go wrong, there's no help. So it's important that antenatal care takes place in health facilities where you have trained personnel that will help you through the journey of pregnancy. Now, when it comes to the screening tests that are done varies from country to country. For example, in Nigeria, I would say full blood count is done to ensure that you're not anemic, and if you are, then they recommend your tablets or folic acid or vitamin B12. We're talking about your genotype, why it's important. Then there's the resource factor, which is a form of blood group. You've got a positive, you've got a negative. Now, if a woman, Abimbola, please. Shubola Abimbola, please. Can you mute yourself? Okay, I'll continue. But can somebody ask Shubola Abimbola to mute him or herself? Shubola Abimbola, can you mute yourself, please? Thank you. Yes, I think I got to the stage of talking about the resource factor. Now, if a woman is resource factor and a resource negative, and the husband is resource positive, there is a possibility that the baby during pregnancy is resource positive. The mother recognizes that the resource positive factor is different from hers being resource negative. And during pregnancy, if there's bleeding, part of the baby's resource factor cells, negative cells, can go into the mother, and this can cause what we call resource isoimmunization. This will not affect the first baby, but subsequent babies may be affected if they are resource positive. It's very important that you know your baby as well as your resource factor. Now, blood group just to make sure that if you need blood, it can be obtained as a possible. So we want to know your blood group. And we also do now infection. It's very common in Africa and in Nigeria, and in most of them and TB, women have hepatitis B screening, HIV screening, and this helps in managing the mother as well as in preventing transfer to the baby. Risk factor, HIV, hepatitis, and in some countries again a number of viral infection screening is done. Now, because of pregnancy, things do slow down in the body. Women have constipation, they are prone to having water infection, and because of that, at every contact that a woman, a pregnant woman, has with a midwife or a doctor, it is important that we ensure that the urine hasn't got signs of infection. So your urine test will be done at each visit. In addition to this is the fact that we want to know what the blood pressure is. Hypertension or pre-eclampsia is common also in the very, very first pregnancy, and every contact a pregnant woman has with a healthcare practitioner, a midwife, or a doctor is an opportunity to check the blood pressure. Now, with the advent of home monitoring tests, mothers now do check this at home as well. So it is important. Now, the other thing we haven't spoken about is the baby. What happens during the antenatal period? It's part of the screening process. We want to ensure that the baby is growing satisfactorily, that the growth of the baby is not restricted. And we get this, like I said, the woman would have had a scan at about 8 weeks to 12 weeks. Ideally, there should be another scan at about 20, 22 weeks. That second scan, which at times we call the big scan, BIG, is to look at the structures of the baby, the head, the chest, the hands and legs, just to make sure that there are no congenital abnormalities. That is, the heart is okay, the tummy is okay, the brain is okay, and that there are no abnormalities. That's very important. One of the mentioned is the screening for Down syndrome. Again, I'm not certain, I'm sure it should be available in Nigeria because there are private laboratories that can run this. Again, it's an area of ethical debate. Yes, if it's a Down syndrome baby, and so what? Some women have done, there's nothing wrong if a child is Down syndrome. They are just different from any other person, but they can also function in a certain way. I'm talking about would you terminate, and termination is not legal in Nigeria. Will you terminate a baby that has trisomy 21? So again, I won't go deeply into that, but it's available for who wants it, because we've got to realize the right of the woman to do what she wants to her body. But let's leave that as it is. Now, antenatal care really is about ensuring that through the journey and at the end of the pregnancy, we have a healthy mother and we have a healthy baby. Antenatal care is about detecting any deviation from normality. A woman is anemic, then you intervene. The blood pressure is going up, then you treat her for that and prevent potentially catastrophic events. Again, if the baby is small, you want to know why the baby is small. Does the woman need aspirin that might help with the growth of the baby? When is the optimum time to deliver a baby that is not growing according to its natural potential? So these are the issues that we do in antenatal care. Now, in terms of the frequency of antenatal care, many years, and when I say many years ago, it could be about 10, 15 years ago, we used to say, come to see us every 4 weeks until 28 weeks, then every 2 weeks until you're 36 weeks, and every week until you deliver. It's been shown that those are too many, and you don't need all that visits to a health facility. And we are mindful of the transportation difficulty in Nigeria and in other African countries. So if a classification, if a woman is considered to be low risk, that is, there are no medical problems with the woman, then they don't need as many visits as what I have just stated. However, if the woman is considered to be high risk, then they need to see a clinician, a midwife, or an obstetrician more frequently. Now, one of the things that I haven't spoken about, which I just mentioned, is risk stratification. High-risk women need to be seen by the doctors. And high-risk women will be people with very, very high BMI, obese women, women who had previous cesarean section, women who were pregnant previously and the baby died. In such conditions, you will need increased surveillance by doing more scans during the pregnancy to ensure that the baby is in good health, and if not, then you intervene at the most appropriate time. So these are the elements of what we do in antenatal care. It's about ensuring the mother is well. It's about ensuring that the babies are growing or is growing satisfactorily, and then determining where and when to deliver the baby. Now, just to put out an appeal out there, traditional birth attendants have a role to play, but one has got to be very, very careful about this aspect, because we do know that if you do not refer patients when things are going wrong, then the outcome is going to be bad. If you refer them too late, then it's going to be bad. So it's either traditional birth attendants are trained in terms of infection prevention and control, or how to take babies, or how to take normal deliveries, how to manage bleeding mothers, If they don't have those training, I will not recommend a woman to be attended to by a traditional birth attendant. More so if there are health facilities, primary health care facilities, secondary health care facilities available in your environment. The other aspect is oh, God can do it, God can do it. There are situations where you hear that women have been in churches or maybe mosques where they've been in labor for days, and then when things are not going right, then they now think of, oh, let us send this mother to the hospital. And most often, it's too late. So faith-based, I won't say clinics. The church is not a place to have a baby. The mosque is not a place to have a baby. The traditional worshippers is not a place to have a baby because they are not trained to handle things when they go wrong. Most women will have a normal delivery, so when you go to church and you have a normal delivery, yeah, that's not for the grace of God. But the problem is you don't or we can't identify when things might go wrong. And when they go wrong, then they can be very difficult. I'm sure we all have heard stories on the press and social media of women dying in pregnancy. It shouldn't occur really. Women dying in pregnancy is something that is really, really sad. It impacts the children, the husband, the family, and I would say no. As clinicians, as advocates, whether when I say whether you're a lay person, let us advocate for better care for our pregnant women. I think the current government says antenatal care is free. Let us ensure that women avail themselves of the services that government has put in place. And let us hold our politicians accountable to ensure that they provide services that women can use. So, ladies and gentlemen, most of the issues that can happen to a woman in pregnancy are preventable. They are treatable, and so my appeal is that we should continue this discussion. We should continue to advocate for our women who bring life into the world, and who without that, the human species will cease to exist. So our mothers deserve the highest quality care that is available. So I will stop on this note and I will take questions if there are any questions. Thank you for listening to me.
Thank you very much, Professor, for that very insightful section. I'm sure we have actually all learned some things that we were not aware of before coming here today. So always a pleasure to be further and further educated from you, sir. I know that we have a question from one of our online participants. If anyone else in the room has a question, please just put up your hands and then we will come and meet you. So let me just kick off with the online question, sir, if you don't mind. She's also dropped her number, so I don't know whether if this is something that needs further discussion offline, it can be handled that way. So our online participant says, I had fibroid, which has been more than 7 years now, but during the time when I was seeing my gynecologist, he told me that if I could have more sex with my partner, it could shift, and then I could have my baby. Right now, though, she's separated. That's the main reason why she's not gone for the fibroid operation. So she would like to know what advice you can give her concerning that. I suppose it's a question of, does sex shift fibroids? All right.
Lovely, thank you for that question. Sex does not shift fibroids. About 70% of women will have fibroids. It becomes an issue depending on where they are situated and again, depending on the size of fibroids. If they are affecting where the baby would normally stay in, then getting pregnant can be difficult. The other aspect that we look at in the antenatal period is if you have a fibroid that is more than 6 centimeters in diameter, then we have to scan the woman regularly just to ensure that the baby is growing accordingly or growing normally. So my advice to the lady who has raised that question, thank you for raising the question, is if you can liaise or link up with my Gynae Issues Foundation, then we will be able to advise you on what to do. And that's why the foundation has been set up, is to be advocate for women. And please forgive me, because I did not make reference to Lady Oyekan, the founder of my Gynae Issues, just to say a huge thank you to her for her commitment, for what she's doing for women in Nigeria. So Lady O, thank you so much for your passion and your commitment for women's health in Nigeria. Thank you.
Thank you, Professor. And indeed, yes, we have Oyinkan Oshisoya, who indeed is the founder of the My Gynae Issues Foundation, very, very passionate about helping, women throughout, not just Nigeria, but wherever she can find them throughout the world, making sure that not only are women heard and women are given a platform and a safe space to speak to, but also making sure that, they get solutions, they actually walk away with a sense of comfort, with a sense of, of knowledge about, okay, where do I go from here concerning the issues. So thank you very much, and I know you'll have an opportunity to address the audience and to talk about some of your experiences and challenges and, blessings as well. So I would just like to ask another question, please, before we just pass the mic to you. Just a curiosity. If a lady, a mother-to-be, has diseases, for example, hepatitis or health issues such as hypertension, is it still possible for her to carry a baby healthily to maturity? Or do those things in any way affect or possibly infect the baby?
You're right. If we take hypertension, for example, now, a woman who's got hypertension, it can affect the woman if it's not well controlled. She can have a stroke. If she has hypertension, it restricts the amount of blood flow to the baby, and potentially that baby can be growth retarded. That is, the baby is not as big as it should be because enough blood, oxygen, and fluid is not getting to the baby. But these conditions are treatable. So if we pick up a woman who has got high blood pressure during pregnancy, there are safe medications that can be administered in pregnancy. And like I said, such women are considered to be high risk, and so they are seen more often than if they didn't have hypertension. So it is treatable. Now, when we talk about infections, I made mention of having recurrent infections, water infections. Again, that is treatable with safe antibiotics, safe for the mother, and safe for the baby. When it comes to HIV, again, that is treatable, the mother can be treated, and preparations are made to ensure, it's the same for hepatitis B, to ensure that the baby during birth doesn't contract the infection. So in certain situations, people do advocate that mothers are delivered by cesarean section so that the baby does not contract the viral or the virus. The other aspect is group B streptococcus. That is very common. It's not a normal bacteria, but it lives in the vagina. The only thing is, if a woman has it, and we don't know, and the baby gets it, then it's one of the conditions that can seriously affect babies. So if a woman has got strep B infection, we need to know such that after the delivery, before the delivery, they are given antibiotics by the time they're going into labor, and after the delivery, the baby doctors, the pediatricians, check over the baby, and if they need to give the baby antibiotics, again, that is put in place. So most of the potential problems that can occur in pregnancy are treatable. And that's why we are advocating, again, giving myself, that women should avail themselves of healthcare facilities, ensuring that the personnel in those facilities are trained people and not just quack healthcare professionals. Thank you.
Thank you, Professor. Okay.
Hi.
Please introduce yourself and ask the question.
I'm Hadeo Laki from Rotary Promotion. So my question to Prof is, I want to have clarification about my personal experience if I should actually approach the health facility. Actually, before I had my first child, I was having a good flow, maybe 2 days. Then after I had my first child, my period ceased. And 10 months after I got pregnant, after having a CS cesarean section, it was automatic CS for me again because I was pregnant with the second child. So I had 2 CS in less than 2 days. And my period still ceased after having the second child. So I had to go in for family planning so I don't have children even though I'm not seeing my period. So coming today, one of my concerns is that since I started using the family planning method and I started with injection, those injectables for years, and just about 2 years ago I changed to the implants, and I still saw the period maybe like once in 6 months and it's very tiny. So I'm concerned. That's why I came that I need to know, should I approach a health facility to find out if anything is wrong with me, or I should do scan, or I don't even know, people say fibroid, I don't even know, is there a way to test, to check if you have fibroid, or what are the things you should check out for? That's one. The second one is about the safe foundation of pregnancy. I know you mentioned in your speech that Nigeria is not yet acceptable with illegal, but I belong to an NGO that we also advocate for such. We try to pass in different ways that the government should give opportunities for women through the health facilities, the health doctor that knows that if the life of the woman is at risk. For instance, imagine me having the third baby, maybe I was pregnant after the first 2 years. I can walk in with my husband and say, this is not safe for me because I also had preeclampsia. Why can't that I terminate the pregnancy? Because it's not going to help me at that point because I had 2 CS in 2 years. And imagine I got pregnant with the third one. Why can't we approach a health facility? I want to find out, is it that because of the dilemma or the government, or what are the ways we can push it? Because it's one of the things we are advocating as CSOs to see the government, to see how they can pass this for women that their lives might be at risk. Like me, if I had that, maybe I didn't go for family plans. So I really need you to help me in these 2 areas, for my personal and the other one for the checking of my health of the safe pregnancy. Thank you.
Lovely. Please, before you sit down, may I ask you, after the first baby, or when you had your first baby, were you breastfeeding?
Yes, I was breastfeeding. Then I had breast loss. Yes, so I did operation. I didn't even know I was pregnant. It was when they wanted to do the breast lump operation and they found that I was 8 weeks gone.
Right. So breastfeeding prevents women from having earrings. So if you are breastfeeding, for as long as you're breastfeeding, you may not have earrings. But that doesn't mean that at some point in time, you wouldn't fall pregnant. That's probably what happened to you when you didn't have periods for 10 months, only to find out that you were pregnant. That's because we know that lactation can affect ovulation. So that's what happens to you. And again, falling pregnant so soon after a very post cesarean section, I wouldn't say it's a problem to worry about women. It happens to women, they're not planning pregnancy and they fall pregnant. Healing of the child, you get things like, don't have a baby for at least 1 year after a cesarean section. Well, I mean, that's ideal. But healing takes place with we usually say 21 days, but it's even straight. So having a pregnancy 10 months after a cesarean section is not something that really one would worry about. And again, it's not an indication. It's not an absolute indication for a repeat cesarean section. These are the issues we have to discuss in Nigeria. I know people will say, oh, you have one section, you must have. No. They must explain to you why you must have a cesarean section. If it's because your pelvis is small and there's a disproportion if you have a big baby, then definitely that or subsequent babies will not be able to come out because your pelvis size is not going to increase. But we can, I can go on and on about this because every woman is different. So, like I said, the pregnancy you had 10 months when you were breastfeeding is due to the fact that you were breastfeeding and you didn't have a period and a pregnancy occurred. The second question I think you may mention about is the CSO role. By the law of the Federation of Nigeria, abortion is illegal, but we do know that it's taking place. We do know that it's taking place. But the question is, and like you rightly said, if that pregnancy is going to put the health of a mother at risk, then there is a place to advocate. And this is where we as the foundation, you as CSOs and NGOs, need to push for a bill in Nigeria, in Parliament, in the Senate, House, that for situations such as that, where a mother's life is potentially at risk, then there should be consideration for, I use the word, there should be consideration for examination. The religious organizations will tell you, or will tell us, that you are destroying another life by undertaking abortion. And so, like I said, it's an ethical, moral, spiritual area in terms of abortion, because people will tell you that you're killing a baby when you go for abortions. So the key thing is to ensure that you do not fall pregnant if you are not ready for a pregnancy by use of the appropriate contraceptives. So I think that's the key thing. It's going to be very difficult in Nigeria to pass an abortion law because of the religious, traditional aspects. But the key thing is contraceptives are available. Let's promote that to our young ones. Let's start talking to our young ones about sex from a young age. Not the ones where you tell somebody when they start having their period that if they want to talk to you. Let's tell them, even before puberty, what sexual reproduction. So I hope that answers the question. And again, if you want a third baby, there's no reason why you can have a third baby.
I'm scared. Well, it's almost 10 years, yes?
Through my line Issues Foundation. We're happy to discuss that with you, since it's personal and confidential.
Thank you very much, Professor. And you know what they say, there's always that love child left out sometimes. Yeah. All right, okay, we'll come up to you now. Please go ahead, your question. Good morning, everybody. Good morning.
Sorry, good afternoon, everybody. Good afternoon, Doctor. It was a very wonderful and rich lecture. My name is Mrs. Mweke Stella Talatu, and I work with the National Youth Service Corps. I am not the head of Lagos State, and the head of Lagos State is the state coordinator. But I work in the scheme, and I am presently working at Ogun State Abeokuta area office as a deputy director in charge of community engagement and entrepreneurship development. While in Lagos, I handled the skill acquisition and entrepreneurship development. That's where I met the woman that invited me over here. And I'm so very, very glad to be here. You see, while growing up as a young lady, we were not told so many things. This is a very brilliant lecture, and please, I want to request that you push it out to very young women. When we got married, we were not even told anything. It's just that naturally, when you are a woman, there are certain things that you just come up like that without you being told what to do and all that. And I got married and I had my first child. I had pre-eclampsia. I was very, very sick. I went into the eclampsia state. I had protein, I had edema, I had high BP, and I was section. They did cesarean section for me to bring out the baby because I was going into the eclampsia state gone that morning when I was sectioned, and I brought out my baby, and my baby, everything went down. And then I got pregnant for my second baby in less than a year and 3 months. Yes. And I was very, very scared. I said, no, they should move the baby for me. I don't want. Because I thought that every pregnancy would be the same. I was very, very scared. And then I was working in the bank. And then while I was in the bank, even when I was very, very sick, I had all the symptoms of pre-eclampsia. My manager did not let me go. I collapsed in the office and I was rushed to the hospital. Then they called my husband to meet me there. I had my second baby, cesarean section. And then I said, no, I don't want anymore. But later, there were 2 boys. Later, I said, no, let me look for a girl.
Microphone is not working.
After 4 years,
Hello.
Yes, thank you.
Then I had my second baby. I was pregnant for 1 month and 3 months, 1 year and 3 months. I was pregnant for my second baby. I had my second baby, and it was a boy. And I now said I don't want anymore, since it was also a cesarean section. I didn't have any problem at all. But just few weeks to my EDD, my son went to school and had poison. He drank a bottle of Coke that had caustic soda in it. And so we were hospitalized with my pregnancy. I didn't sleep. I had to see vein in his body. They had to put the drip on his head, so I was alert, awake for 5 days, no rest. And so I went into fake labor. Before then, they had to section me because my baby was transferred. So I now said I don't want anymore. And then after like some few years later, I said, oh, there are 2 boys. Let me try to be a girl. So I got pregnant 3 years and some months. And when my last baby, like my second baby was 4 years, I had my baby. Through what? Through cesarean section. Because the doctor said, I've gone through 2, they will not let me go through another one. But that is the normal delivery. No, he tried to explain to me, if you stitch a cloth, you lose the cloth, you stitch the cloth again in the same place, and then, you know. So I said, okay, no problem. I don't have any problem. My health was good, everything was good about my health, but it's just all this problem I had during pregnancy. And so I had my baby without any stress, because they allowed me to get even to that 9 months proper. Because my doctor said he was traveling, so he needed to bring out the baby, and then that was it. So I brought out my baby. Even though I had to quarrel with my husband, my mom, everybody, let me try, I can do it. But they refused. So I did the text cesarean section and I had my baby. When I went to do the text cesarean section, I met a woman that came for her 5th cesarean section. The babies were all alive. So you can still go and do your own. It doesn't matter. Yes. So what I'm trying to say in essence is that we don't have to be afraid of anything. If you have a good doctor that will take care of you, you can make it up to the 5th time. Yes. And then our young girls should also know how to take care of themselves. When they are about to get married, they should be taught all these things so that they know how their body circle, the differences in their body and all that before, you know, they start having their babies. Then I also want to, sorry. I'm taking too much time, sorry. Doctor, what I want to ask is that I am AS and my husband is AA and I am AB positive in my genotype. My husband is O positive. But my first son is O negative. What happened? Thank you.
What happened, Professor? Wow, it was an amazing one. I guess Professor is still there. If you still have your questions, we can get over to you, Professor.
Yes, thank you for that. I think you have answered some of the questions, and that's why I raised my clap for you. You said you know of a woman who's had 5 cesarean section. So that's just to show you that women, more so when they are under the care of a doctor, can have more than 3 cesarean sections. It was many years ago that we said, if you have 2 cesarean sections, then the third one must be a cesarean section. And that after the 3rd cesarean section, then that you shouldn't have more babies. But again, that is no longer the case. If you have 3 sections and you want more babies, you will be looked after to ensure that things don't go wrong. Again, I can't go into depth, but like you have rightly said, and I've seen people with more than 5 cesarean sections. If there's no infection, the stitches, suture materials we use now are much better than what we used in the 60s and in the 70s. And again, nutrition-wise, women are healthier, so healing is better. Now, you make reference to preeclampsia. Preeclampsia is something that is peculiar to human beings. When you're married, your husband is carrying genetic material that is different from yours. The child has some of your genetic material and some of your husband's genetic material. And your body recognizes that there are genetic materials that are not your own. And like you rightly said, after that baby was delivered, your blood pressure went back to normal. So it's something peculiar to women in the first pregnancy. And you may recall what I said, every contact you have with your healthcare professional, we should be checking your blood pressure or the blood pressure, just to make sure that it's within the normal range. One of the things that worried me, what you said, was that your doctor said because he was traveling, he or she was traveling, they have to deliver the baby. Well, I don't know how many weeks you are, but that shouldn't be the driving force, unless you had got to maturity. But if that baby hadn't got to maturity, and because the driver, the doctor was traveling, wanted the baby out, what about if that baby now suffers from prematurity, ends up in intensive care, baby intensive care unit? You won't find that doctor. Again, that's why I said choose your doctor. And don't forget, cesarean section, you pay more for cesarean section. And the financial benefit to the doctor at times is the driving force to say, I think, oh, you should have a cesarean section. But have they told you of the risks involved, potential risks involved of having cesarean section? Injury to the bowel, injury to the bladder, injury to the ureter, clots in the legs, clots in the chest, and even death. So it's not a matter of you must have a cesarean section. A woman is your body. They give you the information and you decide what you want. Discuss with people, family, or you can go for a second opinion if you want to. And I think, the resource negative one I will not address. I don't know what's going on. Let's leave that as it is. Maybe, again, it could be that the laboratories have given wrong results. Some laboratories are not really accredited and they'll just write any report out for you. My suggestion is perhaps both of you should check your resource factor again in reputable laboratories. Thank you for the question, and I hope I've addressed them.
Professor, I have a question. The role of the men in this. The role of the men in this, what can we do? Most of the time the women will go for the antenatal care, and we're just there, go and come back. What should the men do? How can we be involved? Because you mentioned, we don't pray for it, but the rates at which women lose their lives during childbirth is alarming. So the men can just sit back and watch. What should they do? What should they look out for? What questions should they ask to doctors when they're going for those programs so that they can ensure that their wives are alive and well? Thank you, guys.
Lovely. Thank you for that. Knowledge is wealth. Knowledge is wealth. That's what they say. Where most of us are now being educated, we've got AI, we've got Google, Dr. Google. You can read about these things. And before going for a consultation, you can write whatever questions you want to ask. I would recommend that, if possible, more so if it's a high-risk pregnancy, that men should accompany their wives for antenatal care. It can be difficult if you are holding a 9-to-5 job where you're not allowed to go, but you may have to take a day off or something like that, or half a day off to attend the clinic. Or if your facility runs a weekend service, then you can arrange to have your antenatal care on a Saturday morning, afternoon, or evening. But men really should get involved in pregnancy. Men really should be in that labor ward to see, not to see what women go through, but to support their wives through the journey. So it's not just about getting a woman pregnant and you sitting at home waiting to be told that, oh yeah, the baby has come. Let us support our women when they go through this journey of pregnancy. It helps with bonding, it helps with the marriage. Again, some men want to cut the umbilical cord when the baby is born to show their presence. So Thank you for bringing up that question. Let's keep Rotary Club has a role to play in this as well to encourage men to attend antenatal clinic when and if they can. Thank you. And just before I advise, I mean, if you cannot attend, with telemedicine now, you can be your home as a doctor. Just can I give you a call through WhatsApp or whatever, just to discuss what's going on with my wife. Or if there's a telehealth service or platform, then you can use that as well. So let's use the technology available to us if we cannot go physically. Thank you.
Okay, thank you. Okay, thank you so much, Professor for the insightful session. So my question is more like a storytelling, but I'm very good with it. And I'll start with saying that I know my mother being the fibroid patient, I know how much she goes through the struggling and doing surgery for her and all that. Now I want to ask, I'm kind of seeing symptoms and I don't want to assume that it is hereditary. I think I read that it is hereditary. I don't want to assume that I'm seeing the symptoms, so I want to be sure what are the symptoms to see, and is it like 100% hereditary? So that's my question.
Okay, thank you. Fibroids are hereditary, but in life there's nothing absolute. There's nothing like 100%. So because mommy had it, doesn't mean that absolutely you are going to get it. And like I said, 70% of women have fibroids. So more likely than not, the genetic factors may mean you are at risk of getting, as a risk in a positive way of getting fibroids. So what I would suggest to you, see a doctor early, have an ultrasound examination to check whether there are fibroids there. If there are fibroids there, it can explain the heavy periods. And again, there are so many women with fibroids, and the very first time they will even know they've got fibroids is when they are pregnant and they go for their post scan, and the doctor or the scan people say, oh, you've got fibroids. So it's not the end of the world, like I said. Early presentation, early investigation helps. So my advice to you, as you said, you're developing symptoms similar to your mother, is to arrange to have a scan done to check. It will tell you whether you have it or not. Thank you.
Okay, ladies, I know we want to ask lots of questions. We don't know how many minutes the professor will still have, but we will entertain more questions. If you can't take all the questions today, you can write them down. So, okay.
Hello everyone, my name is Amaka Olubayo, and my question is still about fibroid. First of all, I've always, right from when I started menstruating, I've always had very heavy flow. And until when I got married, I had my first child. That was when the doctor told me that it seems I have fibroid. And then I went on like that, there was no issue. But the heavy bleeding continued. Normally the first day it will be just normal, then for the second and third day, to a point that most times I make sure I don't go anywhere. Even if I have to go to work, I sit close to the toilet, that's where I walk off to. So, I've stopped having children, maybe, I don't know, but for me, I have stopped completely because I'm over 40 already. But I want to ask, okay, last year I had a scan, and the doctor told me, he's not a gynecologist anyway, it was just my normal routine check. And And he told me, he asked me to go for a scan, and when I got the result, he said to me that it is not, the fibroid, after going through the result, he said it is not risky enough to have a surgery. That we should just keep watching and all that. But I thought after having kids, after having children, the heavy bleeding should have stopped or should have reduced. So what could be the cause? Since the fibroid is not enough to have surgery to remove it. Thank you, sir.
Professor, hope you've got a question. Is there a question, sir?
Yeah, thank you. I was muted. What was I going to say? Yes. You were told that the fibroid is not risky enough for surgery. If you have small fibroids, yeah, you got to weigh the balance of the surgery can be highly risky. I have to say, people can die from surgery. Things can go wrong. So you got to balance, and we said 70% of women have fibroids. That doesn't mean 70% of women go for surgery. There are other ways that, if it's a heavy menstrual bleeding, there are things that can be done to control or reduce the heaviness. There are tablets that you can be given, and today is not about consultation, and that's why I'm not mentioning names. There are insertions like the coil Mirena that can be used to reduce the menstrual flow. But if the fibroids are not big, then you do not need surgery. The only time you will need surgery is if you try simple things first. The tablets, the Mirena, maybe ablation, and it's not working. And then it's affecting the quality of your life. Then that's when you earn having surgery. So surgery is not the first protocol. So your doctor has really advised you correctly. And like you said, the other thing you said was the very first time you knew you had fibroids was when you were pregnant, which is what we were saying is that the first time people will know that they've got fibroids. Am I there?
Yes, sir. Yes, sir. Yes, sir.
Hello?
Yes, sir.
Hello?
Yes. Yes.
Hello? Can you hear me?
Yes, sir.
We can.
Hello, can you hear me?
Yes.
Hello?
Yes, we can. We can hear you, Professor.
Right, just my straight. Okay, I've been talking. Yeah, so like I said, lots of women have fibroids and they don't know they've got fibroids. And the very first time they know is when they have a scan in pregnancy. So my Gynae Issues Foundation is there to help women. So if you have questions, please reach out to my Gynae Issues Foundation and we'll try and link you up. If we cannot advise you in-house, we'll connect you to the doctor externally. So thank you.
Thank you. Thank you, Professor. Thank you, Professor. Can you hear me? Thank you, Professor. Okay. Thank you very much for time. We know that we have grossly extended the time that you had available for us, so we're very grateful. And just like you said, we will collate questions that we have for my Gynae Foundations to answer. So please do make sure that you get a piece of paper from West Anti-Bonami. You can get a piece of paper, pen down your question. Please make sure that it's given to my Gynae so we can be sure to get back to you along with your email address. So we're very grateful. Thank you. I have to ask someone who owns a Highlander with registration number BDG893GZ, ash color, so please repark. It is blocking, it's causing an obstruction. So I hope the owner has heard that we can please relocate that car. Okay, so just nuggets from what Professor said. He said so much and it was very rich, but some key takeaways that please, no matter what issue you're facing, no matter your curiosity, do see a good doctor. It is the difference between life and death. For surgery, for anything, inquiries that you have, curiosities, very, very important. And the other takeaway as well is My Gynae Issues Foundation is really here. They have a vast network of doctors, professionals, experts they speak to who can also give you consultation and answers that you need. In this lady's example, I'm sure Yinka will probably talk a bit about her own experience, which is quite similar to hers. And then, we'll be able to press on. So we are going to be moving on now to the next session. We are very fortunate now to have Oyin Coach. Hello. Hi. We are going to.
Wow, the mics are really, no, I guess it's you thing, the female thing, okay. Probably the mic also just not get together, right? Okay, welcome to the night. We're going to have a discussion here, and I'd like to introduce to you the founder, the young lady that's so energetic, that has a passion for bringing everybody together. In fact, she'll be on your case if you don't move. This lady is passionate about women, all about women, empowering women. That's what we're gathered today. We celebrate tenacity to stand in that field to bring awareness to the cause of women. Ladies and gentlemen, make welcome Ms. Onyeko. Let's begin to get for her. And I'm not to read our profile, but our profile will take forever. Once again, ladies and gentlemen, put your hands together for Ms. Onyeko.
Everyone. I'm so excited to see you all. Thank you so much for coming. Thank you for honoring my invitation. Every time people, thank me or praise me for the things I will do with My Gynae Issues Foundation, it's always an opportunity to thank God, for giving me this privilege. Because me being alive and being here, convene or gather people together is just by the grace of God. When the NYC coordinator over there was speaking, I could relate so much with her story because what she shared about having preeclampsia is something that my mother experienced over 46 years ago when I was born. So it baffles me in this day and age that Nigerian women or women all over the world, maybe perhaps, are still battling with issues regarding high blood pressure. My mother had me at age 21. She was very young actually. And by the time she made it to hospital, the doctors, the midwives, everybody was, almost perplexed because she was unconscious. By the time, they checked her, even I was in distress. So like I said, it's very, very baffling that this day and age, we still have issues like that. So, I'm very happy that you raised those questions. And even today, I also met a lady, or I spoke to Mrs. Darola, and she was actually saying that our high blood pressure is usually after pregnancy. So after she's giving birth to a baby, that's when the high blood pressure develops. I didn't even think that was also possible. I thought that it only happens during pregnancy. So you see how complex. I don't want to call it complicated because it looks like that's a strong word. So just women are they are phenomenal. And so I'm very happy that everyone came. When I first, grew up, when I was growing up, the first passion that I had was actually about maternal health. So it's the reason that we're sort of delving into and making sure that we're speaking more, about maternal health. Prof, enlightened me and said that maternal health actually, consists of gynecology and obstetrics, or maybe obstetrics and gynecology. So gynecology is like a branch of it. So talking about women, pregnant women, women who are going to have their children is very, very, very dear to my heart. Like I said, before anything, when I thought about being able to have a child, that was the first thing that came to my mind. So every time that I hear that a woman has gone through these issues, it just breaks my heart. and I really feel like we can do something. So I'm here to encourage everyone. If you know any pregnant woman, if you know anyone going through, even fibroids, because I also had a fair share of issues with fibroids. So I'm here today as somebody who God has just helped, who's here by grace. Because like I said, my mother didn't make it. I had to be pulled out of forceps, because like I said, she was unconscious. If she didn't make it then, I wouldn't be. If we didn't make it then, I wouldn't be here. And then after that, also going through fibroids, was also, very stressful. So I'm really grateful that we have the opportunity to listen to, someone come to talk to us about, the things that we need to do. How can we prevent these things? Is it possible to, change our diet? Is it possible to make sure that the things that we ingest, the creams that we use, the hair products that we use, can we look at how these things affect us? I'm also, glad that, Dr. Rama is also here to speak to us about menopause, because that's another issue that women are dealing with that they don't understand, People ask me, the other day I was in church, and women, I can tell they're always over 40, because they all had, a fan like this, and everyone was just, in the AC, everyone was just, like this, and I was all poor women, they are going through a lot. They go through a lot. Well, we thank God for the opportunity to be here. And I think, a gentleman also asked, how do men come in? Somebody also asked me that, who is talking about the men? I think it's also time to begin to speak about, men, because apparently men also go through, certain things, when their wife is going through all these issues, they're also going through some, mental health stress. So I think, just being here is being able to convene doctors and people with experience things and just sort of rub minds together and advise young ones. I'm also glad that we have young Rotaractors here, we have students, and so yes, it promises to be an exciting time. Please don't go. We have a lot of things lined up for you. There's a pamper session going on at the back there. There's free health checks, so you can check your blood pressure, which is very, very, very important. People are living with high blood pressure. Yesterday I heard about a woman who was reading her a holy book, and before she knew it, she was gone. So it means that woman actually has some pre-existing condition, like some underlying issues that wasn't properly checked. We have an opportunity of the photo session, the pamper session. So please, just stay with us, and it promises to be insightful and exciting. Thank you so much to Rotary International District 9112 for this privilege, and I also want to say thank you to the team at my Gynecology Foundation. You guys are phenomenal. Thank you for all the work that you do. Yes, and I'll be speaking again about safe spaces, so I would like to leave it to the board right here, so we don't take too much of your time. Thank you so much for coming.
Thank you very much. This is Onyeka, founder of My Gynecology Foundation.
Okay, I think the mic also over here herself. Imagine, so men. So what do you think about this kind of thing? Men should go into the labor ward and just think it's. Oh, I think the Dr. Ram really go into the labor room. So we will learn to appreciate our wife better. If all the women want to say aye. They have it, all right, yeah.
So I actually have a question for the men. When he was talking about how some men want to cut the umbilical cord, how many men actually knew that you have an umbilical cord to cut? Hands up, anybody? Nobody? Okay, I thought that was interesting. I remember when I was, first finding out about delivery, and I went to a hospital, and I just noticed in the delivery ward that there was a man lying on the ground. And so I asked the nurse, I said, what happened? She was like, the man fainted in the process of delivery, so we couldn't stop the operation halfway, so we just had to roll him over to the end of the room. So it's quite interesting. Even in my personal experience, I remember that when my daughter was pulled out, that her father was looking anywhere but at the baby, and he was like, how come you're not frightened? How come you're not terrified? Anyway, it's all very interesting.
Women should be given the put your hands together for all the women!
Okay, so I hope we're having a great time and learning a lot. We have an expert now to invite up. That is in the person of Dr. Rama. She is Dr. Ramaka Chukwu, forgive me. She is going to come and talk to us on the topic of safe delivery and postpartum care, reducing maternal mortality through appropriate prescriptions and post-delivery care. So please, Dr. Rahman would like to invite you. Let me just give you a snippet of her very prestigious bio.
I said we thank you to Dr. Rahman. She was around on the previous one we had. So much information to give us. If you have not seen her, you better sit back and relax and enjoy. Get your questions ready. We have doctors in the house to answer all your questions in a minute.
Okay, so Dr. Raman Kachukwu is a family medicine consultant with specialist expertise in menopause, hormonal health, and adolescent medicine. She graduated with her medical degree from the University of, I got this one the first time, Debrecen, yay, Hungary in 2012, and completed extensive training in Ireland, earning membership of both the Royal College of Physicians of Ireland in obstetrics and gynecology and the Irish College of General Practitioners. She has over 12 years of international clinical experience, and she is also certified in cervical screening and contraception with additional experience in urogynecology. She is the founder and lead consultant of Ralia Health Clinic, a global virtual clinic that provides comprehensive women's healthcare worldwide. Her mission is clear, and I'm sure she'll explain it further herself. To empower women at every stage of life, helping them navigate hormonal changes, reproductive health, and well-being with compassion, expertise, and innovation. So please, let's have a round of applause for Dr. Rana as she comes to speak to us on that topic. Okay. All right. So please, could we have those who are at the back? Could we have those who are at the back in the campus section please come to the front and take advantage of this opportunity to learn? Please let us do that. We can always reconvene with the campus section later. Thank you so much, Dr. Rahman.
Good afternoon, everyone. I want to say thank you for coming out today. I'm just looking at the papers and I know how busy it was. I know how busy. Sorry, I think it's good to find. Yes, I know how busy Lagos can be, so thank you. I also want to thank Leo, that's the way I call her, that's the way I know her, for fighting so hard for every woman. I've only known you for the last 3-4 months, but I can see your passion, and God bless you. I also want to thank Professor Jayesini. I think I said it the last time we had my GAP 2.0. It's very rare to see a man acknowledge women like you do, sir. And I'm happy you're Nigerian. Kudos to you. And I'm also very happy that there are men in the building today. So just not one, two, it's almost 50-50 in your room. So thank you all the men for being here. I also want to thank the Parade Club 9111. Sorry, I'm putting that. Thank you for the opportunity, giving us the fully AC room that I just relocated. I'm shaking in cold. So thank you so much for that. So I'll move on because I've been given 3 topics to talk about after safe delivery care, and also to talk about when the women's life changes from, when they stop having their period, what happens.
Mic is
Can everybody hear me now? Yes. Okay. So I think the first topic I wanted to talk about was safety post-delivery. I think what happens after a woman has birth. I think going from what Professor going from what Professor Janisimi has already said, the most important thing is don't miss your antenatal appointments. Since I started working in Nigeria, one thing I've noticed is that they come in for the first scan within, let's say, 6-7 weeks, and they're happy that they are pregnant. Then the next time we see them is at 20 weeks, so that is known as a big scan. Again, they're happy that the baby. Sorry, they are happy. They are happy that the baby.
Just a minute, one. Now the mic wants me to stand, Captain. Hold on, please.
Oh, beautiful.
That's okay. So I was saying that from what Professor Jaisimi said, the antenatal appointment is very, very important. So for a woman to achieve a healthy delivery, which is possible for everyone worldwide, not only Nigeria, you need to take your antenatal appointment very clearly. I also appreciate men coming for their antenatal appointment. I'm the kind of doctor that I don't just look at the woman and talk to the woman. I look at the husband or the partner or the brother who is supporting or the uncle that is there and let them know what is going on with the woman's body. So the antenatal appointment is very important. I was saying for the 20 weeks when we have the big scans, so we're looking at the baby's head to toe, counting fingers, counting toes, checking the heart, the liver, the kidney. If we find anything unusual, again, it can be managed or even treated. And that also prevents delivery issues for the woman. So one thing I've noticed coming back is that unfortunately they come for 20-week scan and they don't come back. So they come back either with the baby in their arms or they come back. So my advice is please do not miss your antenatal appointment. Husbands, uncles, brothers, you know that your sister that is pregnant, check on her. So I'm just going to run through the antenatal appointment. So once they are pregnant, they should see the doctor immediately, get blood done, and then after 48 weeks, they should be checked, blood pressure, urine should be checked again, and they should be registered. So it's not just check and go home. So they should be registered. So what you should be asking the ladies is, where are they going to have their baby? So which hospital are they going to have their baby? Not just where they go for a blood test, okay? And it should be regular. They should go, at least in Nigeria, because of the comorbidity. So what do I mean? Because there's risks of blood pressure, there's risks of gastritis or peptic ulcer, there's risk of diabetes, which is a big one, and even uterine fibroid that most women don't know they have until they are scanned by a good sonographer. You know that they are aware that they have fibroid, so they need to attend more regularly than it is in the Western world. Okay, so if a woman has gone for all antenatal clinic, she has a better outcome of having a safe delivery. So like Professor Jaisimi said, you can have as one cesarean section, regardless of how many pregnancies you carry. Most important thing is that it's done by a doctor that is aware of the risk that it comes, and you are managed appropriately. So let's say the woman, I can just give you a case. So let's say you're seeing a 42-year-old lady who has given birth to her fourth child by cesarean section. She's day 3, no issues throughout. And just before she was discharged, she complained of headache, and she was checked by the midwife, and her blood pressure was high. I think it's back on. So her blood pressure was up, but because of the cost she decided to go home. So because of the cost, she decided to go home. But I think this is where the partner plays a huge role. Again, not to scare anyone here, but if that woman goes home, she might die. Okay, and then you might be left to take to look after that baby. So that's why the husband should be involved from day one. Okay, so if that woman is having blood pressure, our advice, and you know as your wife, as your partner, I think you should make Okay, sorry. Sorry, I'll browse this quickly. So what I would say is that if the man is involved, then that could also help the woman stay. These are cases that I've been involved with myself. Sometimes the woman is like, no, honey, we don't have so much money, we just need to go home. But because the husband has been involved from the beginning of the pregnancy with me till the end, the husband knows what is going on, and the husband can find a way, to help with that consultation to save that woman's life, and her blood pressure can be managed. Things that we screen for women that has given birth, again, we make sure that the blood pressure is monitored. Again, people could have pregnancy, post-delivery hypertension, even though they didn't experience hypertension in pregnancy. It's very common in Nigeria. Again, for women who have delivered vaginally, they could have issues passing urine. That could be due to bladder injury during labor, especially prolonged labor, where the woman is finding it difficult to urinate or she's even urinating a lot. Okay? Another thing that could happen is uterine vaginal prolapse, where the vagina is coming down. And this is very common in Nigeria, where a lot of women feel stigmatized and embarrassed to talk about it. My lovely guy, Mr. Isaac, did I get your name right? I'm sorry. I love the way it's always engaging that, how could a man play a role in this? So again, that's what I'm saying. The man will not be able to play a role if the woman is not able to communicate to her husband. Okay, most men would like to support us if we can only communicate to them. Okay, so I'm going to jump to the perimenopausal and the menopausal aspects, but I'm happy to take any questions at the moment. Okay, I see a lady. I'll just walk up to you because this is the only one walking.
Thank you, Doctor. My name. Okay.
Fibroid is very massive and is right there inside her uterus. So now she met a gyno to see if she could do the surgery or something. And he told her that, well, after the scan, he told her that he's going to open her up. And if he gets in there, he's not able to do the surgery, he will just close her back. And she's asking, is this worth taking the chance? I want to know, what's your thought? What do you think? And then my second question, I'm a treated mom, and I had my baby through surgery, a C-section. After that surgery, I had this earthquaking cold. It was so intense, as if I was going to die. I just want to know, why does that cold happen? Does it happen to everyone? Thank you.
Thank you for your questions there. For your sister, first, she's a very strong woman, being diagnosed with uterine fibroid endometriosis and ovarian cyst. The advice I would have is for her to seek a second opinion
An ultrasound has been done, it's been diagnosed with uterine fibroid, but I would recommend her getting an MRI. Yes, and it's better if she gets the MRI with IV contrast. So it shows us where the fibroid is, it shows us the size of the fibroid, it shows if it's also pushing again other structures, because and it also shows more on the ovarian cyst. Then with that can give the gynecologist more information whether to go ahead with the surgery or not. If the gynecologist is saying he will open her up and close her up, there's a huge risk of surgery. Okay, so her going for surgery, she's going to be having that surgery, I guess, asleep. So there's risk of anesthesiology, there's risk of bleeding, because with uterine fibroid surgery, bleeding risk is very high. So the bottom line is she needs to see the second gynecologist for second opinion, and she needs to get an MRI. Okay. And also to speak to a fertility expert in terms of her egg preservation. If she's thinking of freezing her egg after getting the surgery done, because the surgery will also come with risks. So it's to have all those discussions done. Okay. Then in terms of your question, the second personal question, you said you had triplets by cesarean section and you had intensive cold after the delivery. Okay, there are a few things that could cause that. It could be the anesthetic solution that was given to you. That can cause temperature drop and it can cause hypothermia, which is an intensive cold. It doesn't happen to everyone. Most anesthesiology, I don't want to look like I'm throwing shit, but most anesthesiology are aware that might happen and they prep for it in advance. So they're checking your temperature, they're saying they drop from 37 to 36, and then they keep you warm. So there are warm blankets that they give you, or they give you warm solution to prevent that. But in Nigeria, every intervention you get, there's a cost to it. So it's not like the Western world where things like this are covered. So they might not ask the lady because the lady might not want to pay for it. So all they are interested in is make sure she's paying covered and she has her baby safe. I hope I answered the question.
Thank you, Doctor. Professor Yolanda from our station. So I'll start from what she said about the code. Like, I had my daughter 14 years ago. So after the delivery, there's this blood coming on. So at point in time, okay, I gave birth early morning, like 4 a.m. and the blood did not stop until evening. They now took me back to the test. Where I met, because at that time I was, so I read the flush memo, I had blood transfusion, and since that day up to now, like I knew something was missing. So after like a week, I had this cold that she mentioned. Like after a week, we had the naming ceremony and all that, and I had this cold, like I felt just, So, as in that time, up to this present moment, I'm not trying to protect myself because I knew something was, I don't know what was wrong, and I complained to them and all that. So, should I get? And I actually want to be a grandma very soon. So, I don't know why that cold. I always immediately after. My own was a week after. That's number one. And I want to have. Is it normal for someone that just gave birth to undergo flushing of the womb again? Thank you.
Very welcome. Thanks for the question. So I'll start with the second one. It's not normal for someone who has just undergone the delivery to have flush of the womb. I don't know what happened then. Normally we don't just flush out the womb of the lady after giving birth. Okay, so you were bleeding continuously. Okay. Again, that can happen after delivery. It could happen after vaginal delivery or cesarean section. It's known as hemorrhage when the woman is bleeding after delivery. So it's known as post-hemorrhage. Okay, post-delivery hemorrhage. There are so many things that could cause it. It could be a bleeding uterine vessel, okay, that wasn't identified during delivery, and that's why you were bleeding. Okay, there are ways of treating it. So going back to basic, and that's why Prof. Jaisimi was saying, even though people want to give birth at home or they want traditional people to give birth, they should be aware of how to treat cases like this. So the first thing we did when the woman has given birth, we rub her uterus, because we want the uterus to contract to prevent bleeding. When the woman gives birth, even if there are no significant tears, the vessels have been dilated for hours, especially in prolonged delivery. That can cause bleeding. The placenta has been taken out. Where the placenta attaches, those areas are vessels, so they're like taps. Okay, so that's why that contraction of the uterus is done. So I guess what they were doing back then was trying to use water to clean a well that is leaking out, water. But unfortunately, that was what was done at that stage for you. I think the intense cold you had was because you were anemic, so hypovolemia that led to hypothermia, because you're losing so much blood and your temperature levels drop. So that can happen over 7 days after delivery, or it will happen there in theater. Did I answer those questions? Okay.
Hello, everyone. I just want to ask, on behalf of we as we are undergoing menopause, is it possible to get, when you start sweating and be sweating, is it possible that you can get dehydrated? Extreme dehydration at your actual lips and your mouth is dry. So what's the solution?
I will briefly talk about perimenopause and menopause, and then I'll be able to answer that. Is that okay? So perimenopause means, I'll just start from the beginning. So every girl is born with the amount of ovaries in their, amount of eggs, in their ovaries, and as the girl gets older, the eggs are released, okay? Again, we're born with an amount, so as we get older as well, our estrogen and our progesterone, which are the sex hormones, starts to decline. Menopause is when a lady has stopped having her period after no period for 12 months, which could happen between the age of 51 to 52. But I think in Nigeria, the average age is in the late 40s. Now, perimenopause is when a lady starts to experience some symptoms of menopause just before she goes into menopause. Again, the reason for this is because the estrogen and the progesterone, which are the sex hormone, and also the testosterone that men do carry as well, starts to get low. So the symptoms, so a woman can be having symptoms of perimenopause and still have her period. Okay. The symptoms of perimenopause are her period starts getting irregular, so it can start getting longer or lighter. For example, if a lady used to bleed for like 2-3 days, she might notice that she's bleeding for maybe 5 days and it starts getting heavier. She might notice that she's not bleeding every month, it comes maybe 2-3 months late. Other symptoms are the hot flashes everyone knows, or the common symptom most people talk about, where the woman is hot from her head to her chest, even if she's in an air-conditioned room. Another symptom that Mom mentioned here is dry mouth, and the reason for that is the low estrogen levels also in the mouth. So it can cause the dry mouth, dry eyes. It could also cause varicose veins that you see at the back of the legs of most women. Another symptom that most people are not aware about is insomnia. Most people might think it's just stress related, but it's a very common symptom of perimenopause. The symptoms are so long, so I'm just going to keep mentioning them. Anxiety is another one. So you notice that your wife or your auntie is more anxious, she's more agitated. When you tell her something, she's just furious. Forgetfulness is one that is not very common. So you notice that your auntie, your mom, your wife has started saying something in a conversation, but then she's forgotten what she's saying. Another symptom could be headaches. So headaches happen as well. But what I would say to people is that please check your blood pressure, please check the pattern of your headaches, and don't just tie it to perimenopause. Another symptom is low mood. Unfortunately, in this part of the world, it's not something anyone wants to talk about, but low mood is a very common sign of perimenopause and also menopause. Dry vagina is a very big one. And dry vagina can lead to dry urethra, where your urine comes out from as a woman. That can lead to multiple kidney infections. So you notice most women keep going to their doctor, that they are passing burning or hot urine. The doctor might not be, depending on who they see, it might be a very, very junior doctor, might give them an antibiotics, and then that antibiotics will cause vaginal thrush, which will cause vagina itch, and then you're treated with an anti-thrush medication, and the cycle continues. I've seen ladies who have been on antibiotics back to back for 6 months, only to find out that it was actually perimenopause. Again, these symptoms are similar to the symptoms in menopause, so you also notice joint ache, so you notice your elbows, your joints, your knees, your back, your neck, they're very sore, they're very stiff. The list is so long. So these things have treatment, and the treatment doesn't have to be hormonal replacement. It could be subtle symptoms like wearing cotton clothes. Like make sure your underwears are made of cottons. Your underwear, your nightwears are made of cotton. Try to sleep with, if you can afford it, an AC or a fan, or now we have the small fans that you can carry everywhere you go. I will also advise exercise. I know when I say it, everyone is like, I don't want to go to the gym, but you don't have to go to the gym. You saw the way I walked that lady. I will tell you a secret. My mom had full-blown menopause at 45. So perimenopause is is the stage you get to in your life before menopause, right? And it takes 7 to 10 years for you to go to menopause. Now women are going into menopause 12 to 14 years earlier. No, sorry, women are going into perimenopause 12 to 14 years earlier. So if you take 45 and you subtract 12 or 14 from it, it just tells you how early most people can go into perimenopause without realizing it. Okay, I'm in my late 30s, so I can go through perimenopause. Yeah. So let me go back to why I shared that story. So that lady wanted to ask a question. I did my exercise. I walked up to her. That was my exercise. I walked back. That was my exercise. I was sitting here. There's another exercise for when the bladder is weak, which happens during perimenopause. It's known as the Kegel exercise, where you squeeze your vagina tight, and it's good for men to know this. The woman squeezes her vagina tight and holds it for 10 seconds and gently relaxes that. So that strengthens the vagina, and that helps with good sex. So that's why I say men should know this as well. Okay. Now, in terms of the dry mouth, dry vagina, for the dry mouth, unfortunately, there's no cure for it, but we can treat the symptoms. So the symptom is drinking water, staying hydrated, chewing on ice, and chewing sugar-free gum to help the tongue produce saliva. Okay, some people say you can get like the Vicks sweets. The non-sugar-free sweets could also help. In terms of the dry vagina, I beg every woman in the room, please avoid using Vaseline, avoid using olive oil. The reason for that is it attracts dust. So it attracts, when it attracts dust, then it attracts microorganisms like bacteria, and fungal infections as well. So it's just to be very careful. There are simple things that we could use, like a water-based lubricant. You can get it from the pharmacist. I don't know how much they sell it, but I think it's less than 1,000 or 2,000 naira for a long tube, size of a toothpaste. Yes, some people say 3,000 naira, and that could last you for a month or even longer. Another thing is to avoid washing or scrubbing the vagina with soap. So soap is the enemy to every woman, young girl, baby's vagina. Okay, water is enough. Another thing is the probiotic. So the probiotic you can get it from yogurt, but please not the sweetened yogurt. Don't use the opportunity to eat too much sugar and give yourself diabetes in the name of trying to eat probiotic. Sorry, in the name of trying to eat probiotic yogurt. So it should be unsweetened probiotic that should be used. Now, I want to talk about the mood changes that happens during perimenopause and menopause, because people don't talk about it, they feel it's a taboo. And it's destroying a lot of marriages, it's destroying a lot of relationships for people who are not married. The hormones, the sex hormones are very, very strong. And I keep you know that men go through it as well, because I've seen men in my clinic with low testosterone, and also cases like erectile dysfunction. And unfortunately, because they can't talk about it, because erectile dysfunction is not only caused by testosterone, it's also caused by psychological changes as well. So it can be caused by, so for example, let's think of a family. The man is age 50, the woman is age 48, she's going through menopause, her moods are all over the place. The man is going through his own mood swing, he can't talk to her about it, and now he has developed erectile dysfunction. So erectile dysfunction, for the sake of men that are in the room, is when the penis cannot be erected first thing in the morning, which is normal anatomy, or the man doesn't have any erection during sexual intercourse. So why is this important? Even the Holy Spirit has emotion. When Jesus was on earth, he has emotion. God has emotion. I mean, when we go for worship, I'm a Christian, so I don't really know much about Islam, but when we go for worship, we sing, we cry, because we have emotions. Emotions are very, very important. I don't want us to take it for granted. Okay, so if you feel that your mood has started changing, people have started saying you're more agitated than normal, or you're more moody than normal, or you're not engaging in social activities as before, I would advise you to take a step back and see, okay, how long has this been going on? What is my period like if you're a woman? What other symptoms am I having? Not just the mood. Is it my sleep, my joints? Is it my work environment? Have I changed my environment? The same goes for men. So I would advise you what has changed in your relationship, what has changed in your line of work. I know the big one in Nigeria could be blood pressure medication. That can affect erectile dysfunction for men, but it's also good to also think about the psychological impacts that can cause erectile dysfunction and can also worsen erectile dysfunction. So that's why I want to talk about it today. I know some people might feel a little bit embarrassed, but this is medicine, and God created us from head to toe. And from head to toe matters, not just our genital area. So I'm happy to take more questions, because I don't like talking too much. I prefer talk and answer. Thank you.
Thank you very much. Good afternoon, everyone in the house. I'm very pleased to be here today. I'm most excited. Also, I want to say that Miss Oshisoya happened to be my long-time line manager at Chapel Hill. We worked together, and I honestly can believe I know her story very well. And I'm honestly happy. I just bumped into this last night in the course of my work sleeping, because everything you have just talked about there is happening to me, except the dryness of my mouth and all that. have experience, or I've been experiencing everything. You know, at some point I wanted to speak before you started, but I said, okay, let me just hear you talk maybe. And you have just mentioned everything, so there's no point for me to ask too many questions. But in the course of this, my question is, my own, when people, like everybody in this room now, the AC is on, right? Thankfully, I'm not sweating right now. When people are hot, I am shivering. When people are shivering, I am hot. And then in the office, you see me, it's raining. People, everywhere is cold. Everybody's shaking. And it's at that point I want the AC to be at its, you understand? So that happens to me. And I'm coming out from the bathroom. I just had my bath. I'm coming out from the bathroom like, I've not even finished cleaning my room. I'm sweating. Like all of this is happening to me. And what else? I think the sexual aspect too. I don't even want to even be touched at some point, and all of this is happening to me. What else I'm trying to remember? Then sleep. For the first time in like all my life, I'm 43. I just checked my blood pressure. It's at 140. It's the first time in my entire life that I'm seeing 140. It's always been 120, 123, and all that. So I didn't need a CCR to tell me I don't sleep. I bumped into this program last night because of my school. I'll just be on the phone looking for what is not lost, and 2 a.m. I'm not sleeping yet. And then I'm going to work. By 5 I should be up. I ought to be dressed for work, and by 6 I should leave the house because 6. Work is 6:45, and then for breakfast to up at 7 o'clock. So I'm already in the office, and I come back again. Well, I don't work all the time. I work Monday to Sunday, but I have all the time in the work because there are times I can just work two times in a week. Maybe I'm working on Monday and I'm working again on Thursday, and the rest of the week I'm free. I don't sleep. I'm just looking for what is not done. I can just can't remember. I don't even rest. Going from Nigeria to Kafaja, looking for what is not lost. What can I do? So there are so many things you can do. Come to Eta Atlantic Memorial Hospital, it's in Ikate. It is not too far from you. But in terms of sleep, yes, the insomnia, the poor sleep is a very huge symptom with perimenopause and menopause. There are a few things that you can take. Magnesium supplements, which you can get it over the counter, is very good. It's best taken 2 hours before you sleep. Another thing I advise people is that let your bedroom be your bedroom for sleep or for sex. So it shouldn't be where you're walking or you're using your phone or trying to finish up your daily activities. So the bedroom, before you go into it, the light should be switched off, and if you start doing it every night, it becomes a habit, and it helps. So switch off the light, let it be a dark room, and let it be well ventilated and cotton night wears. Another thing that you could try is the relaxing teas. So when I mean relaxing teas, no agbo. Agbo is not what I would recommend. I would recommend things like chamomile tea to be taken at least 4 hours before. If you take it too soon before bed, you're going to wake up urinating a lot. So try to find that balance. Try and set a sleep calendar app. That's what I call it. So you have an alarm that you wake up every morning at 5, but you go to bed every night at 8. Now I know in Nigeria it's not feasible because of our work life. Bedtime is 10, 11. But we're trying to train the body to have a good sleeping routine. So the only way we can do that is by being consistent with the sleep cycle. So if you tell yourself, I have like my phone goes gray at 9 p.m. and it goes into DND. So if you are calling me at 9, I won't see it, it wouldn't ring, except I'm holding my phone. So I love to go on LinkedIn and Instagram for work, but once it goes gray, I'm like, what's the point? There's no color, so there's no point using the phone. But magnesium will really, really help your symptoms. There are a few things that could help.
but it's not a consultation today, and I don't want to be throwing medication like Professor Jaisimi said. I'll say speak to okay, yes, you can come see me later at Atlantic Memorial Hospital, or you could go through Lady O, my gynae. She will recommend other doctors that are close by that have passion in perimenopause or menopause. Any other question? I'm doing my exercise now. I will talk about diet too and vitamins you can take.
Yeah. Thank you. I really want to thank Richard Ecoms for creating this platform for women. It's so beautiful. Like, a lot of things in our mind that and now you're finding it out, obviously. So my question is, my first life happened, so for some time, I'm away from, let me say that I'm away from being intimate with, and so 2024, there was a kind of program organized by the UK in my area there. So there's something that they call a pelvic gynecology. So when I had that, the nurse that attended to me, she said, "You're closing up." She said, "Why?" I said, "I know that life and all that." I said, "I should try and live on." So, 2025, I started a relationship with a child. And twice, it's like I went for a checklist of like all my work from my head to my toes. So they didn't know how to do. So, and I didn't know. I was like, oh, it's not. Like it was hard for me, I'm not a doctor. So I use my own name and that will make it more compatible. Maybe there's no alignment and all that. So, but I'm still thinking. I'm still young. And I'm like, it's not like this before. Now it's like this. Is it medical? Is it because I've stayed for some years? Because I was away for many years and didn't even go there. So what could be wrong? So when she now mentioned that she's 43, I'm like, yes. I love the way she handed it back to me. I'm not 43 yet. Yes, perimenopause can, because of the low estrogen and the low progesterone, it makes the vagina dry. So I think that is why the nurse was saying you are closing up, because the vagina gets really dry. Again, having regular sexual intercourse lubricates the vagina, but once a woman has low estrogen and low progesterone, the blood vessels to the vagina is less, and the vagina anatomy is not as elastic. But yes, you can still enjoy good sex, and that is where we recommend using water-based lubricants to lubricate the vagina. Again, I would advise that you see a women's health physiotherapist or a women's health specialist that can advise you on how to do this safely without hurting yourself. I hope that helps. Any question? Any question? No. Okay. I didn't touch on vitamins and supplements that we can take if we're going through perimenopause. So again, you don't have to wait to go through perimenopause before taking them. I would recommend, because of time, normally if a lady or anyone in this room from 18 years plus, there are screenings that should be done. I'm a big fan of screening. So there are screenings that should be done, things like getting your blood pressure checked, things like getting your period symptoms checked. So it's not because you're having your period every month and you're having period pain that you feel is normal. And that is why, things like fibroid or PCOS are being missed early. So if you notice, if you're a very young girl in this room, I'm not been talking about women in their 40s and 50s, but if you're a very young girl, you've started your period in the last 4 or 5 years and you notice that it's changing, it's heavier, it's painful, or it's irregular, or you feel you're bleeding,
maybe every 10 or 14 days. That is not normal. My advice is to please see a gynecologist to get that sorted. Okay. Another blood test that you should be having for any young girl that's having her period should be a full blood count and an iron levels check as well. So if you're between 21 and above, January is the month for cervical awareness. So I advise you to please get your pap smear done. Again, I know people argue, should we be doing it on virgins? So people who haven't had their hymen broken through sexual intercourse, yes, the doctor can still perform cervical. The doctor can still perform a safe pap smear. The hymen is a thin elastic organ that is in the vagina. It has a hole and it can be elastic. It can be stretched, but it's an elastic tissue. So the brush can gently be put in to take samples to make sure that there are no signs of human papillomavirus, which is the virus that causes cervical cancer. So please, for women who have daughters in the room that are 21 and above, I know in Nigeria, screening age is 21. In Republic of Ireland, where I came from, screening age is 25, and it continues up to 65. So please, if you're 60, 61, 62, 63, 64, and 65, do not say you don't need to have the pap smear done. It's very important. Early detection saves life. We keep saying we know it, but we wait for our body to have symptoms before we get checked. So don't wait for your bodies to have symptoms. For men 21 and above, I advise you to get your blood pressure checked. I advise you to also get your blood sugar checked because it's very important, and diabetes is very rampant in this part of the world that we live in. For women and men 30 years and above, again, cervical pap smear. For women, the breast exam should be done every month. It should be done 10 days after your period. For girls, you should check the breast yourself, make sure nothing has changed, stand in front of a mirror. If it's something you can't do yourself, look for a nurse or a female gynecologist if you're comfortable, or a male gynecologist. I just want you to look for someone that is a medical personnel that can walk you through and educate you on how to do a self-breast exam so that you can teach other young girls out there. For men, again, blood pressure check, blood sugar check, full blood count. You want to check your kidneys. You also want to check for diabetes, which is a blood test that can be done as well. So for men and women 40s and above, so for women, the pap smear is important. Then you go from self-breast check to the mammogram, which is the ultrasound scan. In Nigeria, it's done 40 years and above. It's done every year to every 2 years. But if there's a high risk of breast cancer, then it's done more regularly. Again, you want to check your full blood count, your iron levels, your diabetes screen, your thyroid screen, and for men, the same blood test, but you're adding your PSA, which is a prostate blood test to check for prostate cancer, and also to have a prostate exam checked with your doctor. And for people 50 and above, again, I would advise you to get screening done every 6 months to 12 months. And the lady who spoke about her body's temperature being different in different environments, I would advise you to also check your thyroid level, because the thyroid hormone or the thyroid gland plays a big factor on our temperature, and most times it's mistaken to just sexual hormonal fluctuation, not just the thyroid hormones. So it's something to just write down if you're going to see your doctor to get your thyroid levels checked. Thank you. Sorry, I rushed this.
Thank you very much, Dr. Rama. Oh my gosh, she is packed with information, right? So please, for anybody who could not write all the checklist of things that she said fast enough, please go back and look for my Gynae Issues Foundation recording. So, thank you. And now, we have the honor of welcoming Ajayi, gosh, I can't spell it. Onwabuchi is a passionate clinical nutritionist and public health facilitator dedicated to helping individuals, organizations, and communities achieve better health through evidence-based nutrition and wellness strategies. She's not a quack. She is the founder of Nourish Nutrition, that is spelled Noureesh Nutrition, a dynamic wellness brand that offers expert services in clinical nutrition, corporate wellness, and community public health nutrition. At Nourish Nutrition, they provide personalized dietary counseling and meal plans for managing chronic conditions such as diabetes, hypertension, obesity, and gastrointestinal disorders. Their corporate wellness programs are designed to improve employee health and productivity through interactive nutrition workshops, tailored meal planning, and stress management support. They are also deeply committed to public health advocacy, delivering impactful nutrition education programs in rural communities, schools, and underserved populations across Nigeria. So we would just like to welcome now to speak on the topic of nutrition and lifestyle, including in fibroid management. She'll speak about practical, affordable food guidance, and she'll help to bust some myths that she have. Also speaking on the topic of lifestyle shifts that support hormonal health. So she can say as much better herself. I'd like to welcome dietitian Adaeze.
Good afternoon, everybody. Good afternoon. My name is Adaeze Oluwabuchi. I am very excited to be here. First of all, I want to express my gratitude to my foundation, especially the founder, Lady Oyinkon, and also Sister Bola and every other member of this beautiful foundation. I'm not just expressing my gratitude because of the opportunity and the privilege to be here to impact other women. I'm expressing my gratitude because 8 weeks ago I would have been dead. Yes, that's the truth. So today, I'm not just standing here as a clinical dietitian, I'm standing here as a woman that is currently in postdoc that has survived fibroids. So I live with fibroids, and today I am free of fibroids. So a round of applause for my Gynecology Foundation. Okay, so 8 weeks ago I had an open myomectomy surgery. Man, please complete it to me. I had an open myomectomy surgery, and I'm super excited and grateful to be here today to impact lives. Yeah, so as a dietitian, I spent years educating women. It's been over 8 years of me consulting, and I've been educating women about their hormones, nutrition, lifestyle, everything. But nobody knew that 3 years ago I started having fibroids. So while I'll come on live sessions, I'll be in the clinic, I'll be consulting, talking to people, nobody knew that I had an 8 kg mass of pedunculated subserosal fibroid. So let me break down that English. So my own kind of fibroid was not the one in the uterus. No, it was the one outside the uterus. And I'm lucky today that they didn't even give me an L cut. Even though my cut is very long, they were supposed to give me a cut here and here. Because my surgeon told me that the fibroid that was brought out, it was already going towards my heart. So it was a very bad one. So while other women were battling fibroids that led to bleeding, excessive bleeding, I was battling every day with bloating, pains, indigestion, different kind of issues. So everybody will eat and be fine. I will eat even the smallest food and I'll be struggling to breathe. And even with that, I still turned up for my patients. Nobody knew what was going on. But God came through for me. So I want you to understand that it's not just about the knowledge of what is fibroids. I teach women how to, shrink their fibroids. I teach women how to not have their fibroids grow back again. But then I'll go back behind the scenes and I'm asking myself, what exactly is going on with me? I know what to eat. I eat the right foods. I eat healthy. I live healthy. So it's not just about your food. Fibroid is not just hormonal. Fibroid is psychological. Fibroid is metabolic. Fibroid is emotional. And I want you to understand that today. And that is why this story, this seminar is very, very personal to me because I needed to understand that fibroid is not just that benign tumor or the muscle tumors that go in your uterus. Fibroid is beyond the uterus. And in my own case, it was not about the diet, it was not about the lifestyle, it was about something more than that. It was about balance. And when I talk about balance, that's why I said fibroid is also psychological and emotional. So stay with me today. You need to pull out your virus and your papers. Please pull it out because I came fully ready for everybody. Okay, so let's talk about why fibroid is even more prevalent in African women. A lot of my patients will ask me, oh, dietitian, why is it that our white counterparts they don't experience these things? First and foremost, as an African woman, our dark skin it does not produce more vitamin D when we are exposed to sunlight, which is the most common source of vitamin D. So most African women, they have vitamin D deficiency. That is on the standard. Number two, as African women, we have a higher level of progesterone and estrogen in our bodies. That's number two. Number three, it's not like generally all women don't have fibroids, but in African women, our own fibroid cells, they have more estrogen receptors. What do I mean by that? The fibroids in our bodies, they have more estrogen, they react more to estrogen compared to other counterparts. That's why you see a lot of people, they say, oh, it grows in our family. It's not just a family thing. Some people, they don't even have fibroid in their family, but maybe because of the lifestyle. So what happens is that genetically as African women, we're already predisposed to fibroids. Now, our environment, our skin, and some other factors now make it to begin to do what? To begin to grow rapidly. And that is why most African women, they are more genetically predisposed to fibroids. It's as simple as that. So now I'm going to be breaking down the role of nutrition, the role of your metabolic health, and the role of your hormone in fibroids and in fibroid management. So let's look at the first one. Why is nutrition very important in fibroid management? And that's why I'm here today. Okay? So first things first is, let's look at the role of your guts. I always tell people that there are two major systems that play a major role in fibroid management. Your gut health and your liver health. Those are the two most important systems you should watch out for in your body. Now your gut health starts from your mouth down to your intestines. Okay? So whenever they're saying gut health, your gut health is connected to everything in your body, especially your hormones. And you know that as women, our bodies are driven by our hormones, yes or no? Good. So first thing, if your gut health is not right, it is going to affect the presence of what? Estrogen and the metabolism of estrogen in your body. Remember that the two major hormones we have in our body is estrogen and progesterone. Now when there is a dominance of estrogen in your body, what happens? Different hormonal issues start to come up, especially fibroids. Now, what is the major system that breaks down the estrogen hormone in your body? It's the liver. Now, when there's an excess of estrogen in your body and your gut health is not right, what happens is that instead of that excess estrogen to be removed by the liver, to be detoxified, it will go back into the system and be reabsorbed in the system. So the liver is not detoxifying excess estrogen. The liver will leave it there. So the excess estrogen in your body will be causing you different issues. So it's as simple as that. So your gut health has to be right to be able to help your liver. In my own case, when they were checking me, when I was diagnosed with fibroids and all that, they started watching my liver. They told me your liver is beginning to have issues. I said, me, my liver had issues. Then I started going into deep research. That was how I discovered that if my gut health is not right, my liver cannot be right. And aside from my gut health was right, everything was right. But if the body that is carrying both the gut and the liver is not in the right state, forget it. And in my own case, it was trauma. It was emotional trauma that was feeding my fibroids. If you can relate to emotional trauma, please raise up your hands. Thank you very much. Please, this is a no judgment zone. It's a place for us to learn and help each other and impact each other. As women, we go through a lot. A lot. From growing as a child to teenager to puberty to everything to womanhood, there's a lot that women go through. So today I need you to understand the psychological aspect in controlling fibroids. And that's why I came with everything. First thing first in managing fibroids starts from your nutrition. I'm going to show you herbs, I'm going to show you supplements and everything that you need. Okay, so I'm talking about those that have small fibroids and they want to shrink it, and those that have fibroids that are already grown, and then those that have already done surgery and they want to prevent the growth of the fibroids. So please take it in. First things first is you need to watch your fiber intake. So when I talk about fiber, I need the whole grains. When I started managing my fibroids, okay, I turned from eating my white rice, normal white rice, into brown rice. I don't mean ofada rice. Brown rice. Because a lot of my patients say, oh, dietitian, that brown rice, sorry, that's ofada rice. It smells somehow. It is, no, that's not ofada rice. What I was eating was brown rice. You can get it in the market. Okay? Brown rice is filled with a lot of whole fiber, rich fiber. I also give it to my diabetic patients. Why? Because it's complex carbs. Complex carbs it takes time for you to break down into the body. So you release glucose into your blood slowly. Unlike the normal white rice that has been stripped of everything, of the fiber, of the minerals, and all that. Okay?
Once again, just video technical issue.
Okay, so Gary, we say hello. Thank you very much for that. Okay, so let's continue. I'm talking about fiber. Fiber is very important. You know, when we talk about fiber, we start from our most common staple food in Nigeria, which is our rice. Everybody loves rice. Some of my patients, when I'm taking a diet for a 24-hour diet, they will say, oh, that is what I love rice. Morning, afternoon, and night. I understand. We all love rice. But now, it's the kind of rice that you eat that now matters. I will not tell you that you basmati rice. No, I won't do that. I will not tell you to eat your local rice or you should eat your brown rice. Those ones are the ones that are very, very nutritionally dense and they are high in fiber. Then number two, let's look at other foods that are very, very good and high in fiber. Sweet potato is very good. Sweet potato is better than Irish potato. I tell my patients anytime. I will give it to my diabetic patients too. Sweet potato is better. It's high in fiber. It's high in beta-carotene. It's high in vitamin A. It also has traces of protein. So it's better. But please, if you have fibroids, do not eat that. I, for one, yam is my best food. Yes, but I had to eat yam totally. Please avoid yams if you have fibroids. Yes, I know some of you are looking at me like, when how would I be avoiding my pounded yam? Please avoid it. Okay? Then another thing is for some of you that say you don't like your beans. Beans is very good. It's very high in fiber too. Beans is very, very good. I have to incorporate that into my diet. Then we're very lucky that in Nigeria we have a lot of vegetables. Our vegetables are our major source of fiber. We can mention different soups that have vegetables in it. People from East, if you are from the East, say, okay, so people from the East, even people in Lagos, you eat people soup too. Yes. You have your oha soup, you have your bitter leaf soup, you have your afang soup, you have your vegetable soup, okra soup. There are many soups you can take that are very rich in vegetables. But please, if you have fibroids, try to cut down your egusi intake. Your egusi soup intake, please try to cut it down. Like, in fact, if possible, just remove it from your diet. There are other soups you can use to replace it. Yes. Because egusi is very high in fat, and guess what? Those are the things that treat fibroids very well. So you need to avoid them. Go for more of the rich vegetable soups. They are better for you in fibroids, and they help you to prevent the growth of fibroids. Now let's look at the major nutrients and supplements that you need
fibroids. Now I always tell my patients, the first one is vitamin D. Because as African women, our dark skin cannot be able to produce vitamin C in the presence of sunlight. But now, just taking vitamin D supplements alone or getting vitamin D from your food is not just enough. That is why I came with the things that you need. For instance, I'm not telling you to go and buy this brand though. I'm just showing you so that you know, because I don't like to give you anything. I like to show you so that when you go to your pharmacy store or when you go to your nearest chemist, you know what to ask for. Exactly to ask for. Now, when you want to take your vitamin D, please make sure you're not just getting any kind of vitamin D. Make sure you're getting vitamin D3. And the one you can get the one that has vitamin D3 and K2, very, very important. Vitamin D3 plus K2. Vitamin D3 plus K2. Don't go and get vitamin D, whatever. No. Vitamin D3 plus K2. If you can get those vitamin D3 and then get vitamin K2, beautiful. But if you can get a combination supplement like this, it is very, very okay. So for women that have small fibroids and they want to shrink it out, this will go a long way for you. If you've gone through surgery and don't want a report again, this is the best for you. Because most African women, we have what? Vitamin D3 deficiency. Sorry, I didn't hear vitamin D3. Then you come to the back. Vitamin D3 plus K2. Can we all get it? Those are the back. You can get any brand, but this is one brand, okay? You can get any brand of vitamin D3 plus what? K2. But make sure that when you are taking it, it is supervised. You are taking the right dosage. Make sure it is supervised by your doctor. Although when you go even on the can, they'll show the dosage for you to take them. Okay? Please don't go and overindulge or don't go and do it without the supervision of your doctor. That is number one. Now, you can get it from your food too. You can get it from your egg yolk. You can get it from your seeds, like your pumpkin seeds, your flax seeds, your almonds, your almond nuts, your cashew nuts. You can get it from there too. But they are not readily available from your diet. That is why we advise supplementation. Okay? And please, when you are taking your vitamin D3 plus K2, make sure you don't take it on an empty stomach. Please, make sure you don't take it on an empty stomach. Now, another thing that women that go through fibroids suffer a lot of women suffer that, is bleeding. Iron. They always lose a lot, they're always very anemic. In my own case, mine was not growing in the uterus. That's why I was not to experience excessive. But I was going through my pain on a daily basis. Every day, when you eat normally and your food is digested, mine does not digest. I go through respiratory distress issues. I was going through different kind of pains. Because my own kind of fibroid was when I was pressing against all my digestive organs, pressing against my kidney and my liver, so it was really bad. So in most cases, women experience excessive bleeding, and this is what? Iron deficiency. And it leads them to become anemic. That is why you notice that you become very pale. Has anybody ever experienced that? If you experience, please raise up your hands. Great. So many women will experience anemia, iron deficiency anemia. What can you do to help yourself for that? I don't advise my patients to go and get iron supplements. No. Because I know that most of the time, those iron supplements, most of the ones that we have common in Nigeria, they are not safe. So what do I advise them to do? I advise them to use their plant sources of iron and also the animal source of iron and make sure that the presence of vitamin C there. Now, how do you do it? Let's start with the common ones. We all know that we have a lot of ugu. If you know ugu, raise up your hands. If you know this vegetable called hospital tufa, raise up your hands. Good. Hospital tufa, you can find it around. It grows free in people's compound. Now, hospital tufa, if anybody knows moringa, you raise up your hands. Moringa is verified is the highest in the content of iron. When it comes to iron, it has the highest iron content when it comes to plants. How do you now take these leaves? Now, when you get them, you rinse them with your salt water to remove any kind of germs or anything. Then you put it to your blender, add your water into it, blend with seeds, then squeeze your natural orange juice, your lime or your lemon juice into it. So when you guys say to put
your lemon or your lime or your orange into it? Because of the presence of vitamin C. What does that vitamin C do? It will go and boost your body's absorption of the iron. If you take it alone, it's not as if you not get the iron. But if you are taking it alone, if the iron inside that vegetable juice is 100%, you might be getting just maybe 40 or 50%. But when you add the presence of vitamin C source into it, then your body will be getting 100% iron that is in that vegetable juice. It's as simple as that. You will even notice that your skin will be clearer. You will notice that your blood, it will boost your blood, your iron sources in your body. Then let's go to the animal sources of iron. We have your beef liver. Beef liver is very good. Very, very good for you. And also you have your lean beef, but beef liver is better. Chicken liver is also good. Goat liver is also very good. But please, when you're eating these other meals, make sure you're taking them in moderation. Moderation is key. Because some of my patients will say, oh, I said we should be eating other meals. That's why we should buy this, that. No. I mentioned beef liver. Okay? And let's look at another one. Another one is another supplement that is also very good in managing fibroids is your indotrecabinol. Indotrecabinol, you can find it in your natural sources, but a lot of people don't like to take those natural sources. The natural sources is cauliflower, broccoli, and cabbage. If you know cauliflower, raise up your hands. When you see it, it looks like fibroid tumors. Yes, that's the truth. That's plant medicine. If you know broccoli, raise up your hands. If you know cabbage, raise up your hands. Good. Those are the plant sources of indotrecabinol. But for people that cannot be taking those things every day, because people tell me like I go to the market and cauliflower, just a bunch of cauliflower is about 4,000, 5,000. The head of broccoli is about 6,000 naira. How can I be taking it? Blah blah blah. And they're not even tasting nice. I'll say get your indotrecabinol if you can afford it. Because all those extras that are inside your indotrecabinol, this should be your best friend. If you don't want the fibroid to go again, or you want to shrink out the small fibroid, you want to manage it and for it to go forever. You want to ask a question. No, you might not get this brand, but this is indotrecabinol. Check it. Indotrecabinol, yes. Okay, you want to ask a question. Because vitamin C helps in the absorption of iron. That's it. Okay. So let's continue. So I mentioned which one? I mentioned iron. I've mentioned vitamin B3 plus K2, and I've mentioned indotrecabinol that you can get from your cabbage, your cauliflower, and your broccoli. Okay. Now let's look at another one that is very, very important. I always tell people about EGCG. Green tea extract. In fact, this one is a game changer. Many people will say, oh, I'm getting green tea extract from the grocery stores or supermarkets. Those things are not green tea extracts. They are not green tea extracts. This is the real green tea extract. It might not be this brand, but any other brand, go online, call it for EGCG. It is very, very important. And what does this do in the body? You know that excess estrogen is metabolized in the liver. It helps for detoxification of those excess estrogen from your body. And if your body has high levels of stress hormones, it will help to bring it down. Because high level of stress hormones actually leads to increase in what? Estrogen dominance. And estrogen dominance is what causes what? Fibroids to thrive. If you are not understanding what I'm saying, let me know. Are we learning? Are we learning? I will take this again because I want everybody to understand this. Now this is EGCG, okay? It's a green tea extract. It has a lot of catechin, it has a lot of So this one, the green tea extract actually helps the liver to detoxify excess estrogen. When your body has an excess of estrogen, that's what leads to what? The growth of the fibroid. That's what makes fibroid to thrive in your body. but Beauty Extract will help to bring it down. And the compound that is inside that Beauty Extract is the EGCG. So that is what you actually need if you don't want it to be grown back, but that's more fibroids that you need to shrink out. So this actually helped me for the first 2 years that I have fibroids. I was keeping it really little, it was 2 cm, I was just pushing it like that, like that, like that. But the fibroids were growing. They were growing. Why? Because the body that was carrying the fibroids was going through a lot of what? Trauma. So trauma messes you up. Okay? Excuse me, everybody. Okay, so let's continue. So we've talked about EGCG, we've talked about the other ones. Now, there are people that are having nervous dysregulation. That also causes fibroids to thrive in the body. When we talk about nervous dysregulation, if you're a woman here and you've had an issue whereby maybe you see, I don't want to call the medical name yet, maybe if you see somebody or you get a phone call, you will start having anxiety, break up your hands. She's raising her 2 hands. If you've ever experienced anxiety disorder, put up your hands. Maybe if you hear something, or maybe if you see somebody all of a sudden, you feel this thing that will move from your throat into your stomach. Raise up your hands. Or if there's somebody that when you get angry, you feel the emotions in your stomach. Raise up your hands. That's nervous dysregulation. In medical terms, we call it PTSD. When it is complex, when you see PTSD, it can happen as a result of different things. It can be work pressure, it can be family pressure, it can be relationship issues, it can be death, they give you breakfast, different kind of things. It can be the death of a loved one. It can be that sometimes you're pushing your office, they don't want to give you, they don't give it to your enemy. Yes. Yes, or maybe you went to a prophet and they told you the person that is behind your issues, that man at the back. Anytime you see him, you start. Yes. That's nervous dysregulation. Now, another thing is that nervous dysregulation affects fibroids. It makes fibroids to grow, yes. In fact, it will feed fibroids. So fibroid is beyond gynecology. It's beyond your uterus. It goes a long way. So the body now uses the fibroid as a shock absorber. So when that shock comes to your body, the fibroid will take it in. So you can see that God, when God made our body, there's a lot of intelligence going on. The fibroid is also protecting your body. Because if your body is taking that shock, so maybe you see that man that doctor says is one behind your problem, you just can die. But the fibroid is taking that shock. Even when you eat the right food. That is why everything about fibroid has to do with your balance, your hormone, your psychology. It's very important. Now, what does this do for you? This is magnesium glycinate. It's also good for women that are in their menopausal ages. Okay? So, for your nervous dysregulation, this helps to calm your nerves down. Don't get magnesium bitrate or whatever, citrate or whatever. Get magnesium glycinate. Can everybody see it? Yes. Magnesium glycinate. So when you go to the pharmacy, tell them you are looking for magnesium glycinate. Glycinate, yes. It goes a long way to help your what? Nervous dysregulation. And somebody that is used to a lot of stress, your cortisol hormone is always on the right. This will help to bring it down. So these are the supplements and the vitamins that can actually help you to be able to manage your fibroids. For those that have small fibroids, to help to shrink out. If you continue being consistent. For those that have had surgery, to help you not to regrow again. Okay? Now let's look at the food you need to avoid. But before we break into food you need to avoid, let me talk about the herbs for fibroids. And I came prepared. Yes. Please pass it around so that I can see. This is black pepper. This is flaxseed. Pass it around so you can see. moringa seed. This is ginger. This is turmeric. And this is garlic. Please pass it around and I'll explain. That's moringa seed. Please pass it so that everybody will see it. So I'm going to be explaining the work of these herbs in the body to be able to manage fibroids, to prevent regrowth, and to shrink the small ones. Please pass so that everybody will learn. No wait, I don't know what you see. Which one? Glycinate, yes. Okay, so now that passing it, let's very quickly explain because of our time. So one thing that makes fibroids to grow in the body is inflammation. Okay? Yes. When inflammation is high in the body, it will make fibroids to grow very, very big in the body. Please just pass. Thank you. Now the first thing first is to include an anti-inflammation diet. Anti-inflammatory foods into your what everyday eating. Let's start with anti-inflammatory foods that we have in our kitchen. We've already passed ginger, we passed turmeric. Ginger, turmeric, and black pepper, they are very, very good anti-inflammatory spices that you can include in your everyday diet. Now, why did I use black pepper? Please, everybody pay attention. Pay attention, please. If you finish passing, please bring it back. Thank you. Thank you very much. Thank you so much. Okay, so these are the top three anti-inflammatory agents that we have. Among these top three, these two are the most important ones, turmeric and black pepper. Turmeric and black pepper. In the market, Yorubas call it the atale. The atale they call it. Atare. Atare. Sorry, I'm Igbo. Okay, so I always tell my patients to combine turmeric and black pepper. Turmeric on its own has a compound called curcumin. Curcumin is the anti-inflammatory compound in what? In turmeric. But it cannot just work on its own. But it's not exactly if you take turmeric on its own, it will not work on your inflammations and all that. But see this black pepper. There's a compound you need called pepperine that when you combine it with the curcumin in turmeric, it will make you to work like 1000x. Yes, when you combine turmeric and black pepper, there is no inflammation. Even I use it for my patients that have arthritis. There is no inflammation that is in your body that will not start breaking down. It works like magic. Yes, I will explain it. So you can add it to your smoothies, you can add it to your soups, your stews. You can decide to blend garlic, ginger, turmeric, and black pepper, and you put it in your honey, and you take it 1 tablespoon morning, 1 tablespoon at night. You will see that that pain, that inflammation, that fibroid, go again and go and check. You see that the small ones will start going down. You see that the symptoms will start going down. It's as simple as that. I'm not here today to gatekeep anything. You can also use it for your teeth too. It's very, very important. But make sure that when you're using your turmeric, you're using it your black pepper. So you can combine ginger, turmeric, and black pepper. But please, if you have ulcer, don't take this cream. Because it's highly spicy. Okay? If you're learning something, say hello. Hello. Great. Thank you very much. Now, okay.
When I eat my stew, I use turmeric, ginger, and garlic. So can I add that black pepper to blend the pepper and marry it?
I have a question.
I just want to say that I'm pleased right now because there is nothing I make. I don't think that much. Soup, anything I do that I don't add these items that you have mentioned, except the battery. So I'm surprised now, and in fact, it's quite
You're welcome, you're welcome. Okay, so let's continue. So I have here with me, let's talk about classes. I have garlic. I don't know what you said, I don't like garlic, I will smell like Chinese, I will smell like Indian person, blah blah blah. But you see this garlic is one of the greatest wonders in the world. I'm telling you the way it is. Remember that estrogen is found in your liver, right? And it's your liver that breaks down estrogen. And it's when you have excess estrogen in your body. That is when all those things like fibroids, hormonal issues, PCOS, and all those start. How do you help your liver to detoxify? Is add your garlic to your diet. In fact, when I was younger, I used to look at my dad like, sometimes my dad would be chewing on raw garlic back there. But the truth of the matter is that growing up and then becoming a clinical dietitian, I discovered that this is one of the greatest wonders of the world. If I start telling you about garlic, you won't leave here today. The major compound in garlic that helps for detoxification and also all those antibacterial and antiviral is allicin in garlic. So garlic is very important. Some of you might say, oh, I prefer to garlic pills. But my dear, garlic, you can eat it to marinate your meat. You don't eat it and just pour like that. You can eat it to your meat, you can eat it to your smoothies, you can eat it to your hibiscus tea, that's your zobo. It's very, very good. It's very good for women. And for women that have a history of candidiasis, vaginitis, inflammation in the vagina, things like that, all those small infections. When you have garlic in your diet, it will prevent it. And it helps to boost your immune system. So garlic is very, very good. Okay. Now finally, let's look at our seeds. Seeds like flaxseed. Flaxseed is very, very good. If I start telling you about flaxseed, it's not only for women, it's good for men. The men that come to my clinic, people that have erectile dysfunction issues, people that have low sperm count, low sperm quality, I always put this in their nutrition therapy. Flaxseed is very good. Women in menopause, flaxseed is very good for them, especially those that experience frigidity or dry vagina. It's very good. It's very, very good. And it's a very high source of zinc in the body, so you need it. Flaxseed help you a lot. So please incorporate it into your diet, okay? Now let's go to moringa. Moringa is also very good. Remember I told you that the leaves are very high in iron. And the seeds are also very high in iron. But the seeds are higher in calcium than iron. So you need all these things in your body. They are very, very good. There are other herbs too, but because I couldn't get them here, I couldn't bring them. But you can get milk thistle, dandelion roots, chestberry, they are very, very good for fibroids. But please, I want to warn you about something. When you are taking these things, make sure that you are taking it under the supervision of a nutritionist, dietitian, or a naturopathic doctor. Don't just go and take it and say, I don't know the dosage, but it's like this one, shall maybe because they say my fibroid is good. Let me take like 10 cans. No! Please, I'm begging you, do not do that. Make sure you are taking it under one supervision. Okay? So that's basically about that. Now let's look into the lifestyle. How does your lifestyle affect your fibroids? How will you incorporate the right lifestyle habits that will help you to be able to manage your fibroids, shrink it out, or avoid it from growing again? First things first is what is called your circadian routine. What is that? Your sleep. You see, this sleep is very important. If your body is not getting between 6 to 8 hours of sleep, you are not doing your body anything, especially as a woman. There's a lot going on in our bodies. We are very sure of pressure. Workplace pressure, family pressure, society pressure, everything is on us. We have a lot of body we're carrying. We manage a lot of things. We try to put a lot of things together for falling apart. So there's already a lot of stress, mental stress, emotional stress going on. The only thing you can do for your body with self-care is to give your body the right rest. Some of you go to bed by 12, 1 o'clock, you are waking up by 4, 5. How many hours of sleep? And you keep doing this over and over again. Guess what you are doing in your body? You are building up with stress hormones in your body. And when your stress hormones are building up, let me tell you what to do. First things first is that you start affecting your hormones, start hormonal imbalance. Secondly, your fat stores will start increasing. So no matter, even if you don't become a shareholder in high fitness gym, that fat will not leave your body. Yes. It will not leave your body. If you like, jump from here to your normal, that fat will remain in your body because the stress hormones are very high and it is hindering the fat hormones. Now, when the fat stores are very high, guess what? Your fibroid, you are killing them. You're just giving them the skin to eat. That's the truth. So they are all interconnected. So please make sure you're getting enough sleep. Now, another thing is, we've already talked about your diet. Make sure that in your diet, all of you that like all those processed foods, biscuit, small chops, chip, this and that, shawarma. Please cut down. So when I go out and my friends are like, oh, you don't drink carbonated drinks. I guess because you're like, so I said no. No. Because when I drink those things, even if I drink it once in a while, it will go and be boosting those words, the fibroids, it fits them. Alcohol is even one major thing that boosts, that fits fibroids. If you've been diagnosed with fibroids, don't say, I only take alcohol during weddings on Saturday, or I only take alcohol when I'm with my friends. No, cut it off totally. Cut it off. There's no religious anything about it, just cut it off. If you want that fibroid to go, or if you go through the surgery and you don't want to go back, cut alcohol off. Yes, if I start breaking down the science, alcohol and fibroid growth, you will not go on today. Just cut it off. Then your canned food, your processed food has a lot of preservatives. They are not good for your body. If you want to manage fibroid, you don't want it to come back, don't shrink it out. Avoid those ultra processed canned foods and whatever. Because the kind of chemical compound they put in them is not good for your body. It causes hormonal imbalance. I particularly had to switch from my relaxed hair to start growing my natural hair. Because most of our relaxers, they cause hormonal imbalance for us. And they affect the growth of fibroids. They increase it, they speed it up. So even some of you that say, oh, I'm only rubbing organic cream, organic skincare. Most of the organic, if you tell you what is inside the organic, you would prefer to go and be buying your Vaseline outside or Pancana oil. Because most of those organic are even worse than the carbohydrate bleaching cream. Yes. And these are the things that will go into your bloodstream through your skin and it's not be messing your body up. But the truth is, let me tell you something you don't understand. As women, our bodies, even though it's complex, it's so beautiful. And it builds itself most of the time. That's one grace we have. If you start eating the right foods, incorporating your fruits and vegetables, the right herbs and everything, it will show in your skin naturally. And you are avoiding stress, it will show in your skin. Your skin will be healthy. I tell most people that your outer skin is as a lot of what you put inside your mouth. Whether you like it or yes. So these are the things you need to watch. These are the things you need to watch out for. Don't be like this, my fine brown skin sister, and say you want to be like Madam Iko in 2 weeks' time. You are killing yourself. So most of these things of our skin is what is causing us issues in our bodies. Because as women, our body is hormone driven. And most of those chemical things we use, there are some artificial hormones they put inside us that actually interact with the hormones in our body and messes it up. That's the truth. So these are the things you need to watch out for. Okay? So at this point, I've said a whole lot of things. I'll open the floor for questions. If you have any questions, raise up your hand and I'll give you the mic. Okay? The floor is open. What's right?
So, when I first see them, straight to camera, I was not like, so when I first looked at the panel, and I saw nutrition, I said, thank God. It's high time we allow nutritionists to be out there instead of just listening to the medical doctors sharing impact So I'm actually a nutrition, a student of nutrition and dietetics. So my God is a clinical nutritionist and a dietitian. When you were mentioning every of the supplements, I remember people saying that when I'm talking to people about health, they will be like, health is only meant for, eating health is only meant for rich people. And then I force them up and telling them what it really means by eating healthy and how they can actually eat healthy without spending too much. And I think you've showed us a lot. Even my book is filled up already. And where my question now is going to is the part of the supplements. Supplements is expensive, right? And because we know that this food we are eating, some of them are not well presented, they go through a lot of things. We want to be sure that when we buy these supplements, spending a lot of money for it, and how can we be sure of the brands we are eating? Number one question, how can we be sure? Number two is, a lot of people now think, okay, when I can get these nutrients from supplements, I will stop eating healthy. I'll just be drinking tea and take all the lights, then I'll take supplements. How can we help people to understand that as much as you're taking yours, the supplements is also important. I stay away from junks and like. Then you talk about 7%. You mentioned some extra herbs aside the turmeric, like the last two, you were very good. Like, hey, I need to call you back to link up. So that's my thing. Thank you so much. God bless you.
Okay, thank you very much for those questions. So I'll start from the third one because it's very simple. Get elderberry or chasteberry, okay? Elderberry or chasteberry is very, very good. Then you can also get milk thistle that we have for the liver, okay? Milk thistle. So milk is MILK, then thistle is CHISTLE. Yes, milk thistle, okay? It's very good for the liver. Then we're talking about the other question is about people that eat jobs and feel that they can run a supplement. I get that a lot. So a couple of weeks ago, I was talking to my friend. She's in the UK, and she was telling me, "Oh, Ada, I'm going to be taking medicine I like. So first, I'll get my raw woman and I'll be drinking it." I told her, "Babe, you eat anything you like. I can't get raw woman supplement. You continue to be my patient. That's the truth. You want that? Okay, so I told her that you need to start from your diet. If you're eating junk and you're thinking that supplements will help you are wasting your time. That is the truth. You are definitely wasting your time. Now let's look at supplementation versus the real food itself. The real food itself is the basic foundation. Before this house was built, there was a foundation, right? We're not hanging on there. So your good food, your healthy diet is the basic foundation. So for instance, if you are diabetic and you say, "Oh, I'll go and eat anything I like," but at the end of the day, I'll go and take a glucose. You will damage your kidney, you have diabetes, and you have all the complications of diabetes. That's the truth. So it starts from your diet. Now, how do we get to eat healthy but affordable? I will tell you the way it is. In Nigeria, we are blessed with organic foods. That's the first thing. Because when we go to the US and all those Western countries, most of the time, when we travel and go to other places, we see that you can't even get organic. Organic food is even more expensive than the GMO foods. That's the truth. So the thing we have in Nigeria that we shouldn't tell God is that you can go to your market and you can grow your vegetables. You can go to the farmer's market and get your vegetables. So eating healthy is not expensive. I don't want us to plan any diet today, but if you can even plan a fiber diet, I can mention to you, you can bring your breakfast, lunch, dinner with your herbal teas, and you see that it does not cost you a pocket. They are simple things. When I do prescription medical nutrition therapy for my patients, give them meal plans and all that, they'll be like, I used to think that eating healthy is very expensive, but just like you said, it is not expensive. What did I mention? Ugu, this, that. Your ginger, you can still get, even though ginger is very expensive, you can still get ginger of 500, yes or no? Yes. You can still get turmeric of 500, yes or no? Yes. You can still get your moringa seed 500, yes or no? Yes. You can still get your garlic even 200 naira, 500 naira, you can still get it, yes or no? Yeah. So why can't you eat healthy? Your beans, your rice. You don't need to know, I don't give basmati rice to my patients. I do not do that. I'll tell you, go for local rice. Go for brown rice. Yes. There are different kinds of beans you can eat. So eating healthy is not expensive, please. But is it taking medication to maintain that health? It is very expensive. So you can even do without supplements. You don't have to. But make sure that if you are taking supplements, you are eating right. That's just about that. Have I answered your question? Yes. Perfect. Okay, we have another question. I want to say something.
Hello everyone. Well, I just want to commend and introduce the bringing institution because you see, once you are telling everybody, once you are telling the younger ones, we didn't know in our own generation. And I think that is why we have a lot of health issues now and all the things we went through. And you know, I have this opportunity to interact a lot with the younger ladies and younger generation. And you know, and I've been talking to them about all these things we're talking about eating healthy, not eating all these things in order all the time and so. And one thing I also realized that yes, some people have the knowledge, but most of them don't have the skills. I think people went through that. Because I remember that when I was having my I want to be, you said you bring this into your daily life. I didn't have the time to give ginger or anything because of that. I would just make the thing and stuff because I have too many things to do. But the thing is that after I go and I started having all these health complications, I realized that it is better than to have them in your daily life than to be buying drugs to what they can easily check for you. So it's a good thing that they are planning that now. I was talking to by also my because when I wanted to, most of all these things I've been talking about. When I wanted to start a business, when I was talking to these children, I said, let me do these things for you. If I do it for you, then you take over from there. I'll let me clean your garden for you. Let me build this because when you do, especially for big women, young ladies, they will be having all these stress or all these things you're talking about. So this move that we also talk to the younger ones and make them realize the importance of taking their daily routine now as a prevention.
Thank you very much, ma'am. Thank you very much. So on the contrary, just to add something to what you said, just to buttress the point. The older generation, let me know if you can say because mama is still very young. And still young and growing. Okay. So the older generation, like when I was growing up, we didn't have, what we had then was, I think when I was growing up, that was when they started introducing 2 minute noodles. Does anybody know 2 minute noodles? 2 minute noodles. That was when they started introducing, that was the first ever Indomie that we did. Before the Indomie started coming later. So there were a lot of things that we were used to growing up. Growing up, we did not have fast food, we did not have Globo that we just stop. We did not have chicken. Chicken was not a thing. It was maybe Mr. Lee's. Mr. Lee's was like everything. In fact, if your husband is taking Mr. Lee's for adults, and then children on Sundays. If your dad is feeling so happy and he's a rich man, you'll take it to Mr. Lee's on Sunday, one Sunday in a month, or maybe on Christmas Day. Then in our house, it's only on Christmas Day we used to fry chin. But nowadays, you can get all these jumps around. Everybody wants to jump. Nobody wants to cook anymore. Okay? So please, let's take this into consideration. And I will see many of my patients, they'll be saying, oh, my children, they don't like Nigerian foods. They only like Indomie, spaghetti, chicken crunchies, or whatever. Please, let's try to incorporate it for ourselves and for our children. Thank you so much. Thank you. So, do we have any other questions? Okay.
Yeah. Thank you very much. Yeah. I'm actually a graduate. I've studied agricultural history, basically population and protection. So I just want to go stress on this point. And I had my last child 2 years. And after that, a lot of things went wrong with me. So at the point in time, after that time,
I noticed that I have white nose. And even when I'm moving, if you move around, yes, pull my clothes. Okay, nice one. You know. And even sometimes I want to sit down, to just do like this. Okay, I won't be able to sit. Gym. So I went back to my rooms. First of all, I consulted with my friend who is a consultant in UCH, and he told me this because of what I had to be managing it. Yeah, I cannot manage this thing. So I went back to what did I do? I had a scan. I saw it, they measured it, I collected the results. And I went to these pharmacies. By myself, combined them together in a pot. And I started taking it as a tea. Hello. After 3 months, I went back to do the scan. And what do you call them? Sonorous? Yes. He asked me, Madam, keep the room. So I smiled. He said, this thing has come back to pieces. And since that time, up to this present moment, I just said to see once in a while. So what am I trying to say to everyone here today? Like, I don't have a platform where I can share this, my father was sharing it. This thing on this table will take you away from the theater bed when it comes to Bible. I did this for myself. And I told him, like that man, I told him, this is what I use. And up till now, once in a while, I'm going to do the stand, it's like I'm furious. So this is the best of Joe. Thank you.
Okay, so there's something I forgot to add before we almost. So another thing is I discovered in my journey of fighting fibroids is that I discovered that milk, I have to switch from normal cow milk, conventional milk, you understand, to plant milk. There was a lot of things I had to switch in my diet. That was why I was like, God, what's happening to me of all people? It's not like maybe I'm the greatest or anything, but I'm the one that is getting women out of this. So how come this thing and that this thing is still growing? You understand? So I discovered what was happening. I knew that, okay, fine, it's not just gynecology. So please and please, if you've been taking milk and you have fibroids, start cutting it down. Possibly cut it off totally. So people ask me, what's your alternative? That was when I discovered that there are recipes for plant milk, that when you take it like this, in fact, I'll tell you for free. In fact, my journey through fibroids is what gave me my glowing skin. Yes. Because I had to now start, I had to look at my body, I had to understand that, okay, there are some things that you need to cut off totally from your diet. And milk is one of those things. I don't want to delve into milk today because lactose in milk is one major thing that is affecting most of us human beings, not even talk of women. So please avoid milk. You can substitute with your plant milk, like your tiger nut milk. There are recipes for tiger nut milk that you'll be like, wow, tiger nut milk is very good, coconut milk is very good, soy milk is very good. But people are saying your soy milk, watch it. It should be in moderation. Because there are some hormone disruptors that are inside some soil that when you take it too much, it will also affect your estrogen levels. Okay? So you want to say something now?
Thank you so much. I think you touched this that adults don't digest milk.
Yes.
So men and women, we should actually not take, milk. A lot of times when people take milk, we find out that you are bloated. Your stomach is bloated. Some people are lactose intolerant. You start hearing your stomach growing, especially with people with fibroids. You get did you hear that? Because you can actually hear your stomach going and you be like, am I the only one hearing this? And other people hear it. So, adults don't digest milk. So not even just for women, men as well. As adults, please stop taking milk. If the one you drank from your mother is enough. Thank you very much.
So finally, just add a little point to this before we call it a wrap. For the milk thing, there's an enzyme that's, is called the lactase enzyme that is in the body of humans, okay? Now that lactase enzyme is only present in your body from 0 to 3 to 5 years old. So from 0 months old to 5 months old, sorry, to 5 years old, that is only when you have the lactase enzyme in your body. Now that lactase enzyme is what breaks down the lactose in your body. So as humans, we don't have any business with cow breasts. Like saying dogs shouldn't be drinking the breast of humans. We can't even imagine it. But the reason why science said that we should be taking milk as humans is because among all the animals, human cows are the ones that have the strongest bones. So we as humans, we are trying to borrow their milk so that it will help our young ones in their developmental stage. And after 5 years old, as a human, you don't have any business with cow milk again. So it's as simple as that. Because from 5 years old, that lactase enzyme begins to deplete so fast in your body. And by the time you're an adult, you don't have lactase enzyme again in your body. That is why you have lactose intolerance. It's as simple as that. So
amazing, but guess what? It's not yet over. I like what we're doing right now, because the next thing is this. We're going to be deliberate, because we have some women probably they don't know their status. They don't know what, if they have private or not, what they need to do. So we're going to hear, you will come in handy. We're going to have a discussion. What can I do to detect? How can I stop it? Then you come into the nutrition, what the person can do in the early stages. Because right now we have someone that can, so what we detect, we can deal with it. But first and first, how do you detect you have this, or you have symptoms of this thing called fibroid? How did you know it? And what steps did you take, and what mistakes did you make, and what would you have done better? Then when we answer that question, we'll call in the doctor to tell us what could we have done, what food intervention would have worked in that aspect. So this discussion is just going to another level. Thank you very much.
Thank you very much. I'd like you to talk about that lactose intolerance. Okay.
So yeah, meant for a patient that have fibroid, I guess it doesn't work with them. So you were saying something about it. So I wanted to know to what extent can the patients take, because most of them doesn't work with them.
Okay, so if you notice, let me take it in my whenever I do dietary call for my patients, before I give you a diet therapy, what I do is I ask you some vital questions. Do you have food intolerances? Do you have food allergies? Are there food phase? Are there things? So when we look at that, you might not even know that you have a food allergy until when I start counseling you and I start asking you questions. So you will notice that maybe sometimes, that's why you now remember that sometimes if I give you soya milk, I have bloating, I have indigestion, or I start having breakouts. That is an allergy or an intolerance. Your body does not tolerate this. So in that kind of case, it's better we substitute it for you. You cut it off totally. Do you understand? That is. And when you cut it off and you see that, okay, my body is no longer reacting this way, that is one thing. Do you understand? So the person has to watch it, because soy on its own contains some nitrate. It also contains some estrogen, some plant-stimulated estrogen hormones too, that actually disrupt your own natural estrogens. That's why they say some men should not take soy, because it's high in estrogen, plant-based estrogen. You know, estrogen is for women. And when a lot of men take it, it's believed that, science backs it up, that when a lot of men take a lot of soy, it affects their testosterone levels too. That's just as simple as that. Yeah. So somebody that has fibroids is already having an excess of estrogen in their body. Estrogen is already dominating among the hormones. So the person is trying to find a way to cut it down, not to increase it again. So if when you're eating so much of soy, it will help to increase it, to be stimulating it, disrupting it, and to multiplying the dominance. Do you understand? So that's just it. Soy milk, soy products generally. Yes. So you shouldn't take it to excess. If your body can tolerate it, you understand? Yes, if your body can tolerate it, but don't take it in excess. Do you understand? Don't take it. Just even when you take orange or banana in excess, it will cause you side effects. Everything should be taken in moderation. Do you understand? That's just it. So talking very rapidly on the lactose intolerance thing, let me say it again. As human beings, we are human species. We are not goats, we are not cows. Do you understand?
So we don't have any business with other creatures and their milk that are supposed to feed their young ones. But because we are trying to help our own species, that's why in science we decided to bring in the milk from cow. Now, why are we bringing in the milk from cow? Because among all the animals that God created, cows, they have the strongest bone and their milk contains the highest level of calcium. And we know that in our own young ones, we need this milk for the development for our babies to have strong bones. Do you understand? Now, God that created everything knew that we need this thing. So he put an enzyme, and also with evolution too. We have an enzyme in our body called the lactase enzyme. That enzyme is only available from when you are 0 months old from the womb to when you are 5 years old as a human species. From 5 years of age as a young child, the lactase enzyme begins to deplete. It begins to go down. So it is required that even if you are going to take milk as a human species, your body can only utilize the milk from cow from 0 months to 5 years old. And that is when your body needs to do was to grow the bones. True or false? That's the developmental stage in life. So after that stage, you shouldn't have any business with milk again. Generally. You shouldn't have any business. So it's just like we find our clients as humans. So anything from that time, once the lactase enzyme is no longer working in your body, it's already depleted. That is what will make you as an average human adult to start having lactose intolerance. And what are the signs of lactose intolerance? Bloating after you take milk, indigestion, heartburns, here and there, even acne breakouts for women, even for men too. Then to also start disrupting your hormones. That's true. Okay? So that's about that. Then talking about the question that he asked me, what are the signs to detect fibroids? There are different signs. So different women, there are different things. Now let me start from my own case. How did I know that I had fibroids? First of all, I started noticing a lot of abdominal cramps. I started noticing bloating that I knew that was going on. I started watching my diet, it was not still going. Okay? And I noticed that I started bleeding in between periods. So maybe my period normally will be for 5 days, and then after that 5 days and everything, maybe in a week or 2 weeks time, I'll start seeing bleeding again. And I'm wondering what exactly is going on. Then I had to go to the gynae to go and ask questions. Okay? Then when it started going, I started noticing that I was having very painful periods. That's number 2. Number 3, I started noticing that I started feeling pains. Even when I'm not seeing my periods, I'm feeling pain. Then whenever I eat anything, I'll be feeling bloated. So one side of my stomach can become bloated and things like that. And I was like, what exactly is going on? So in my own case, my fibroid was not growing inside my womb, inside my uterus. It was growing outside. That is the subserosa kind of fibroid. Outside, more like hanging on the stalk, like a mango tree that has mangoes on it. Outside the uterus. Okay? So when it's hanging outside the uterus, you will not experience excessive bleeding like most women experience. Because it's not inside the uterus, it's not inside the womb. So mine was pressing on my digestive organs. That's why I was experiencing bloating, indigestion, and those pains. Because it was outside my womb, but pressing on my vital organs. Now there are other women, most women, they experience excessive bleeding. That's what happens. That's the first sign that they know that they have a fibroid. Then they'll be having a lot of, they'll be having abdominal bulges. It will start growing and they'll be having abdominal bulges. So for people that they have fibroid to the side, maybe outside their womb, they'll have it, maybe one side will bulge out or this other side might bulge out. For people that have it in the womb, in the uterus, their abdominal parts will start, bulging and start looking like maybe you're pregnant, 3 months pregnant, or 6 months pregnant. In fact, I've seen people that were looking as if they were pregnant, and people thought they were like full-term pregnant. Then you start having these excessive back pains. Then you start becoming anemic. You'll be having this excessive fatigue. Even after a night of good, I will experience so much tiredness and fatigue. Even after eating nice food and everything. Even when you take Locozed to boost your energy, you will still be feeling tired. So these are the things that can happen that you discover, okay, I need to check myself. Don't say it's your village people. Your village people don't have any business with your fibroids. Go to the hospital. I know what God cannot do does not exist, but you should actually take care of your health. I say a lot of women, you already see the bulge. When you see the saying, what God can handle those days, you rubbing only for it, it's good. I'm a Christian too. But still, wisdom is completable in everything. So if you have other people that want to add to this, to portray the point on symptoms to look out for, please, the floor is open.
Thank you so much. This is phenomenal. Thank you. Thank you. Can you give a round of applause? Thank you. With women with fibroids, what's that noticing that, your skirts used to wear size 8, but all of a sudden you're beginning to wear size 10 or 12 because there's this perpetual bulge in the lower, abdomen. You know that, that's almost a sign of, fibroids. So you need to check it. Some people have cramps, you mentioned cramps, excessive bleeding. So before you used to use 1 pack of sanitary towels or maybe 2 packs of sanitary towels. All of a sudden, it has increased to 4. And I think it's also important for women to understand what's normal in period. So it's very important that we take information like this to even secondary schools, because when we talk about fibroids and endometriosis, I remember back when I was in secondary school, there was a particular young lady who used to land in hospital every month. She'd be crying, rolling from one end of the road to the other, in a lot of pain. And she'd be saying things like, oh God, if she thought I just take her, she can just die. Can it be so bad? And everybody just used to laugh at her that she's just, an unusual kind of person that is only you. They used to ask that question like, it's only you. It's only you. Now that I know what I know, I wish that I was able to support her at that time because that lady went through a lot. She'd be crying, excruciating pain. So when you begin to have painful periods that doesn't seem like normal, don't say, oh, my mother said to me that when we start having children, because that's what a lot of people say, oh, my grandmother said when you start having children, the pain will reduce. We need to start checking. When a child that is just under 12 says that, oh, this pain is too much when she has a period, we need to take that child to see a gynecologist so that a gynecologist can investigate and know exactly what the problem is. Once you check it on time, once you catch it on time, you can actually make it to the body. I think those are very, very vital things to also check. In children, we need to teach young children what it is to be, what is normal and what is not normal. So that when things like this things happen to them, nobody gaslights them. Because there's nothing as bad as you having this pain, crying, and everybody says that, is it only, is it not a woman's thing? Everybody has periods, every man has periods. Why is your own different? Don't let anybody gaslight. If you feel pain, speak up. Say that you have pain. Go to the hospital, see a doctor. You're not, some people say, your pain threshold is low. No. If somebody is going through pain that's making them go up, that's making them not able to go to school, that's not making them able to go to work, then we need to check it. So those are some of the other symptoms that people need to look out for. And when you have it, don't be afraid to speak up. Don't be afraid to ask for help. Reach out to us, in my gynae if you need help. We'll be able to point you in the right direction. Thank you very much.
Amazing, well said. My next question is going to be, how do you live with the problem the person has fibroid right now? How do you handle it? You have it. How do you go through that situation? She said you need a safe space. How did you overcome yours? How did you come out of that stigma to say, I need a safe space, I can trust this person? How did you come out of it? Is there anybody that wants to share experience? When you had that challenge, you discovered it, it was a shock to you. What did you do? How did you handle it?
Okay. All right. There are other people here who want to share. Please feel free to share. But I think, the most important thing with, fibroids is owning up to the fact that, there's something unusual in your body that needs to be addressed. That's number one thing. Don't just say, I wish it away, I pray that it will go away. If there's something that's not normal in your body, as a woman, we are our own best health advocates. You know your body better than anybody. You know your body better than any doctor. So if you feel something is not normal within this cavity, within this body, you need to, speak up. That's number one thing. Right. Number two is that, don't be afraid to ask for help. There are safe spaces. We need to begin to
normalize some of these things. You know, when a woman has a period, it's normal. It's not abnormal. I remember in those days, once a woman has a period, they'll say, you can't make moi moi, don't let my moi moi be. I remember, they tell me, don't come near my moi moi because the moi moi will not solidify. I don't know what period has to do with moi moi. That the moi moi will not cook because somebody is on their period. So all of these myths, we need to get rid of them. I don't think, you know, all of midwife sales, we need to grow up and, you know, this is 21st century. There's nothing that your moi moi not being done has to do. Maybe you put too much water and release the water for next time so that the moi moi can solidify. So those are the things you need to honor and find, you know, somebody to speak up for you. If you cannot, when you go to the doctor, you know, you also need to be able to tell the doctor exactly as it's affecting you. Tell them what it, you know, it's giving me a headache, it's giving me back pain, it's giving me lower abdominal pain. Because the things that you tell your doctor is what the doctor would use to understand what's going on with you. Doctors they are human beings, they are not, you know, God. But they just use your experience. What you're telling them is what they use to diagnose the condition. Do you understand? So if there's something not right within your body, number one thing is honor. Number two thing is, you know, you are your own best advocate, so speak up for yourself. Number three is, if you cannot speak up for yourself, find somebody who can support you. If it's your brother, we need to also be speaking to boys. You know, from secondary schools, we need to tell boys, this is what it means to be a normal period, this is what it means to be a healthy woman. If the woman starts, you know, crying in pain when they have cramps, when they have, you know, periods, then, you know, I need to know that, oh, as a boy, I'm going to, you know, tell my sister that we need to go and report this to the doctor. I think those are some of the fundamental things I need to address. And and reach out to a community. Look for somebody who's gone through the journey. You know, sister here talked about her experience. You know, not every experience is the same. So she had a different type of fiber, which is pedunculated. The pedunculated fiber is a kind of a fiber that hangs off a stalk. So it's like, you know, when you have a leaf, when you have a tree, and you have branches on it, and then you have something hanging off the branch. You know, the reason that pedunculated fiber is painful is because sometimes it twists on itself. And when it twists on itself, in that process, maybe there's no blood supply or whatever, that pain is excruciating. A lot of people have it. You know, if you have it in pregnancy, oh my God, it can be hell. So just, you know what is normal with your body. When something is not normal, raise up your hand, ask for help. Don't be afraid to ask for help. Don't let anybody gaslight your symptoms. Don't let anyone say, is it only you? Everyone has a fire, that has a period. Thank you.
Ladies and gentlemen, the next woman that will be
So I'm going to talk about what happened.
Yeah, but before you start, because I know you should listen to her. Her experience is really full of knowledge. But before she continues, if you're ready for any makeover, your woman may be ready for a beauty makeover. It can be signified, not just for people. You're ready for beauty makeover 1, 2, beauty makeover. They'll do it here. I just want to get the numbers 1, 2. As the course of the program goes on, we will indicate, Madam, you're number 1, and Madam, you're number 2. Is there any number 3 there? Okay, let's beauty makeover. 3. All right, so 4. So we have 4 now. 1, 2, 3, 4. We'll do it at the same time. The first one can proceed. Others, please listen and learn from a survivor. Thank you, ma'am.
Okay, well, you asked a question about where you have, when you discover that you have fibroid, how do you handle it? So I'm going to give you a practical example, and I'm not going to be talking about myself. I'm going to talk about my youngest sister. And we just gone through like 2 tragedies in the family, so I don't think any of us were in like a good state of mind. And then I just got a call from my mom, and she said, your sister looks pregnant. And she was ranting and like, I should be pregnant around this time because my sister at that time just left university. That was my home. And she's not talking, she's not doing anything. I remember my mom shouting and telling me, I don't want to have again. I just buried 2 people and she shouldn't abort it if she's pregnant. So I called my sister to come in and then let's have a discussion. But so when I looked at her, she did look like that. So I said, what's going on with you? And I said, are you pregnant? You are pregnant. You know, there's a way you talk to the doctor, right? You are pregnant, don't worry. We'll look for you. Let's just see what we can do. And then she said, she's not. And that she was so upset and everything, and she started crying. And she said, she just, when I asked for her to come over, she went over and did a scan. But she knew there was something wrong, we had to. And she was like, it's only if there's immaculate conception that she can be pregnant. But actually her stomach was very bigger. So she said she went for a scan and they said, you have fibroid. And she didn't really have much knowledge. So when I came with, I said, well, I started really about the 20 years back, even though at that time I think I had like all my kids. So I said, but luckily for us, there was a neighbor that was very good and was my friend. So I said, let's go there, let's just go have a discussion. And the man looked at her and said, how old are you? And she said, she was 24. I said, well, do you have a boyfriend? She said, she has something that she was said, you have fibroid. I will have, and we will remove it because it's actually very big. Looked like they told her it was like a 7-month-old pregnancy. And the 21-month baby, not pregnancy, yes. And the doctor said, if you know you are sure of this, you are married, and you are going to go to marry you soon, I will remove it from you tomorrow. But if not, go. When people are ready, because something about these things, I don't know what, maybe that's what she had, they tend to go back. And that's what he gave us all the theories about when a woman gets to a particular age and your body knows that it's time to start reproducing. If it's not reproducing anything, it will create something for itself to take care of. And so our own body, because she was getting to that age and there was nothing for the womb to carry. So the womb produced something for itself to carry. So he said, go get ready to carry something. So that when I remove, then you can replace it with a child. So she went back. And like 6 months or 7 months later, she said, okay, my man has proposed. So we went back to the doctor and we removed. Like a month after our marriage, she was pregnant. And that was how the issue of the fibroids was solved. But I was happy because she was totally ignorant. Actually, we had someone that we could talk to that could give us, because I imagine if we had removed it immediately at that point, probably we would have removed the baby before she got married or something after, because probably it would have gone back. So, I guess that's what I would say. If there's an issue, please talk to someone that is knowledgeable. Don't try to do something else.
Thank you very much, Mama, for that. We get this a lot, and I'm going to also share from my own experience too. So most times they tell young ladies, if you know you have fibroid, the person will ask you. I remember the first time I was diagnosed, the sonographer was like, dietitian, and this one that you have fibroid. First of all, before you told me I have fibroid, before you even mentioned it to me, first of all, look at me. Do you have a serious relationship? I was like, what does serious relationship have to do with scanning? Or God, tell me what's going on. He said, because the way it's going, please get pregnant very fast. I was like, I don't understand. If and they get pregnant, I'll give you the pregnancy. What is going on? So he told me you have fibroids. I said, okay, so what does that have to do with anything? It's man or whatever. Now, because this fibroid, if you don't get pregnant fast, this one will happen, that one will happen. So it's the same in medicine that if your body has gotten to the peak of reproduction, okay, and you don't start making babies, your body will start making babies. It's a saying, it's like a slang in medicine, the popular saying in medicine. If you don't start making babies with your body as a woman, when you're supposed to make babies, your body will automatically start making babies. And the babies your body will start making is fibroids. You understand? Now, this now puts a lot of women under a lot of pressure. Because I remember when the fibroid thing now started getting really bad, and that was part of what caused me the trauma. I believe it's a safe space for us as women. That was part of what caused me the trauma, because the person I was seeing at that point was not using that fibroid to gaslight me, to make me settle for less because I have fibroids. So a lot of women go through these things. and we end up being in the wrong hands because of these things. But I told myself, no.
From 1 to 11.
Yes. So, in fact, when the whole thing started, that was how the fibroid that was just 3 cm went from 3 cm to about 18 cm. Yes. Because I was now trying to bend it to fit into a space where I don't belong. Because I was being gaslighted because of the fibroids. So these are the things we need to understand. That's why when I started this talk, I said, fibroid is not just gynecological. It's not just about your uterus. It's about the body that is carrying it. So fibroid is emotional, it's psychological. It has to do with balance. Because I've had this fibroid for 2 years and it wasn't disturbing me. It was just that 2 cm and it wasn't going beyond that. Then all of a sudden, it now started growing because I was in a toxic environment. So the anxiety, the PTSD, everything was making it grow. Then when the gaslighting started, it now had exponential growth. So please, nobody should gaslight you into staying where you don't belong because that's what will make that fibroid to go back. If you're in a toxic environment, it will make the fibroid to come back. Even if you get pregnant today, you can still get pregnant, and then after your baby, you will still have another fibroid, and it will be worse. Because I've had patients like that. And having patients like that, then I didn't understand until I experienced it myself. So please, as women, we should understand that our womb is our power. And if your womb is contaminated, when I say contaminated, it's not contaminated by food or dirt or germs. It is contaminated by the wrong energy. It will show in your body. Okay? So that's my point. Thank you very much.
Well, amazing. I have another question for us. Because now, after we create that safe space, we know that, okay, we discovered who do I run to? Who do I talk to? Who do I share? It's like there's a stigma in the society. If I can tell you, they're like, really? Now we found out that we need to get to a safe space where there's positive energy. How do we create that positive energy? And how do we reach out to help? And what can we do in the society to mitigate against it?
Okay, so I'm going to answer this other question again. Safe space. The beautiful thing about women is that we have community. And one beautiful thing about healthy women communities is like a sisterhood. Yes. If you find yourself a healthy, I don't mean community where they do competition, K vibes, Instagram babes, body, fake it till you make it. That's not a healthy community. Or snatching people's husband community. No. I mean healthy, we are laughing. I mean healthy female communities are like a sisterhood. Sisterhood that holds you accountable. Sisterhood that is there for you. And I happen to find one and I'm a beneficiary of one. That is why I'm here today through Sister Oinko and Sister Bola. At the Gynecology Foundation. So if you happen to be here and a woman and you've not joined my Gynecology Foundation, you've not joined the sisterhood, then you are not doing yourself any good. So please find you a healthy sisterhood, a healthy community of women to join. Women that will understand, women that will not keep good things from you. You understand? Because there are communities you will join and they will know this, they will have this knowledge and they will gatekeep it. We don't gatekeep in our community. We are out to save you. That is the truth and that is what sisterhood is all about. So please find somebody, find communities, then you can go online, find them, even on Facebook. There are different ones. Okay, find them. Don't only be attracted to communities where they are checking the latest bullshit or the latest Instagram vibes. No. Go for healthy female communities. That is where to start from. Then aside from that, you can also go to your nearest health center and talk about it. A lot of women who have been silenced, who have been made to believe that, okay, once you're a woman and you're going through anything, try to, hold it in. Try to hold it in, save yourself. Nobody's coming to save you. No, it's not true. There are people out there that are coming to save you. It must not be a knight in a shining armor. It can be the mama, the midwife, the matron, the nurse, your church member. Talk to somebody. And don't think about it. I've gotten to a point in my life where before I used to think, oh, if I tell this guy that I have fibroid now, he will run away. You start looking at me like I'm barren or something. It's the same.
up your hands. When they say, oh, she has fibroid, are you sure she can give birth? Are you sure she can take him? Those things are silly stigmas, forgive my use of words. Yes. They will look at me, they will feel that you're infertile or something. No. I've come to that stage in my life where I don't care whatever you want to say because of your ignorance. You don't know it, it's your ignorance. Your ignorance shouldn't be my problem. So if I tell you I have fibroids and then you feel that because you don't know about it, and you don't even want to know about it, you don't want to be enlightened or educated, and you run away. Beautiful. That's your loss. That's my gain. That's the truth. Because I just lost an ignorant person that doesn't want to learn. So please don't allow anybody to gaslight you or stigmatize you into now being your shell and you know how to talk to someone. Because if I know I'm going to this mama in my church, she just go and put it in CNN worldwide. Let that one put it in CNN worldwide or get your solution. That is the truth. If you don't speak up, you will not be saved. And many women will be silenced for so long. So please, I'm encouraging and impacting every woman out there, speak up. Because it's when you speak up, you get solution. Thank you very much.
Amazing. Speak up to get solutions, and we're speaking up here. One more question for us. Now, let's go to the founder. How can we advocate women's health? How can we push that frontier? You've been in for a long period of time. You've seen several things. How can we do it right? How can this nation get it right concerning women's health?
That's a very big question. Thank you so much. So women's health is very important. And, we notice that it's actually not getting the right kind of attention. I like to say this a lot because, I'm not that, this feminist that people talk about. But it's important to know that, I hear people say that, if this was something that affects me, fibroids or something that affects men, that maybe we would have found a solution to it. Well, maybe to a certain extent that could be true, right? But how can we push this further? A lot of research is required. Do you understand? Research is one thing that will make us understand. Everybody is nutritionist Daisy has told us, all sorts. So in that nutritional space, we see how the food that we eat, affects body and all that. We see that, doctors tell us that, because we're predisposed naturally because we're black people. Some people say, it's because, if your mother had it, because my mother had fibroids, so, because I had fibroids, automatically, I take it that, because my mother had it, I definitely would have it. It may or may not be true, but how do we find out if it is the exact thing? It is by doing research. Do you understand? So if fibroids and other ailments that affect women can be given enough attention, can be people who advocate for health, they focus on it, they go and do research to understand what exactly is the root cause of these fibroids. What can we do? Right? So that it is definite, we know that this is the definitive cause. I think that's the first thing we're going to find out. If we find out the root cause, then nobody wants fibroids. Who wants to have 3 surgeries because of fibroids? Do you understand? In fact, 4 major surgeries to deal with fibroids. So people don't want to go through all of that. I'm here, I do the one that I do so that other people don't have to have the number of surgeries that I've had. But I'm saying to you that fibroid costs me that much stress for me to have so many surgeries. So I think number one thing is advocacy, by speaking up, by making sure that, this is getting the right kind of attention, that everybody that needs to support women are supporting women. And also by taking this education beyond, just, a small gathering. It is taking it into, secondary schools. Let children learn from a young age. Learn from an early age. What is normal? Let us understand what is normal and what is not normal. I think those are the first things I need to do. I will let Mr. Amola, the buttress that points, but I think those are the first, important things I need to do. Research more, speak up for yourself, advocate for yourself. You know your body better than anybody else. So if something is not feeling right, be quick to raise up your hand and and speak up. Find somebody that has gone through the experience before. Because when you have that kind of person, when they help you, it means that, the problem that you have is half solved. Anytime I speak to women, it's always incredible because it feels like 80% of the problem is gone. And 80% of the problem is actually the fear factor. Once you take out fear, then they are ready to explore the options. But it's the fear factor that makes people, that holds people back. I don't want to die. I remember the first time I heard about fibroids. The first person that I know that had fibroids, she actually didn't make it, she died. So from that time, anytime I hear about fibroids, God, that woman that died. But no, it doesn't have to end in death. If you go to the right doctor, I always say that a few things that women need to do. Everybody needs to choose their doctor with prayers and with a lot of sense, common sense. You need to understand that not every doctor is your doctor. Now, doctors are knowledgeable, but doctors sometimes also want to prescribe a solution that is easiest for them. You understand? Because they have the ratio of doctor to patients is like, I don't know, the disparity is so huge. So they cannot speak to everybody, give you 30 minutes because they don't have 30 minutes. They have one patient for this in one doctor. Do you understand? So when you go and speak to a doctor, you have to have prepared all your questions. So that, as you're asking their addressing, doctors also, may not really pay attention to you if you're not speaking up for yourself. Because they can only talk to you if you even understand what is wrong with you. And you can explain to them. So if you can explain what's going on in your body to a doctor, the doctor cannot use X-ray to see your body, physical eyes. Do you understand? So he can only prescribe and diagnose based on what you're telling. Do you understand? So I'll cut it short, so I'll just leave it there. Thank you very much.
Well, I want to actually talk about some of the things you spoke about. And I was going to say that I listened to a lot of things here today. I've learned a lot. But I keep waiting for that thing that's basic for us women. And I'm not, yes, people have been touching it around. And we've not really addressed it, and that's the basic. And that is we as women should love ourselves first. A lot of, I'm a woman, I'm a mother, and I'm a wife. But you see, when we want to put the hierarchy, you put God, then you put maybe your children and your husband, depends on how the level of importance is. Then probably you put your business, and then maybe you put your church, and then you put maybe your friends. You are usually at the last rung of the ladder. You have settled everybody before you remember it. Maybe that's how I was. And that was how I lived my life. So why would you have stressors? Why would you have fibroids? Why would you, when you don't even have time for yourself? When you don't want to? Let me give you a very funny, a practical example that till today is still, I don't know, it gives me anything, I don't understand. I started a business. It's food, it's designed to reduce stress for women in the kitchen, We've done these things for you halfway, so when you enter the kitchen, you don't spend more than 10-15 minutes. And I was so sure when I was planning it and I was talking to people, I was like, all the wives and the mothers, this is for them. It's the solution to the problem. We won't be spending so much time. After like 6 months into the business, I found out that they were not my customers. They liked the stress. They loved the stress. In fact, they were feeling guilty. My customers were the younger ones, from 23 downwards. Those ones, they don't care. Once I told them, you won't peel ginger, you won't put garlic, all these things are healthy things. I've done it for you. I've made the stew for you halfway. I've made the lovely for you halfway. I've done this for you halfway. You just enter your something, do this. They were even asking me, give us instruction, how we do it. We are allowed for the kitchen. They don't care, they take it. But the mothers and the wives, they will take once and put it in their freezer for the day they are exceedingly tired and their husband is asking for food at 3 a.m. That's when they remember. So it's only for once in a blue moon. And in fact, me as a smart business person, of course, I changed my marketing to and dealt with people that had the same, but this thing, I think a lot of it. You go to work with men, you come back. He will sit down and watch TV and people. You will enter the kitchen. One child is pulling your name, another one is telling you. The one is calling you and saying, why have I been calling you for the past 5 hours? I am not picking my calls. And another person is calling you, she just says, okay, I just wanted to say good morning. They don't care about the fact that you are tired. I need to be just working at them all day. They all expect you to attend to them first. And you are simple than anything. And I've brought you something that makes you easy and then feel guilty. Why? And I think that is why I said this because we don't have self-love for ourselves. And that is why we have all these diseases. We should start thinking proactively. These days, you see, when I thank God for my daddy issues, thank God for bringing home, I remember the day she forced me to the hospital. I was telling her that I can't go there, I'll go tomorrow because my husband gave me some instructions and I had to do it first, finish that first. So I said, please let me just go tomorrow. And she's like, your blood count is 5 and you are saying you want to go and be looking for something. You can die now. And I kept on saying nothing will happen to me. They actually dragged me into the car, dragged me to the I was still telling them, no, I'm not going to stay here. I have things to do. But when I saw the bed, and I saw the same people that I was trying to satisfy. Oh, they showed nobody was loving me, but nobody was sleeping in the hospital room with me. That's when I started choosing myself first. Because if you die today, everybody will continue living. Those children will mourn you. After 6 months, life goes on. The husband will mourn you, and the next few months he will say it's not good for a man to be alone. And so the person will marry. And that will be the end of that person's story. And that was when I started choosing life. So now I put God first. Then I put myself second. Then I put my children. Then once in a while, my husband, my business, my husband, my business is moving like life. I can't keep myself. And that is it. So I'm telling you today, all these health things, the basic thing you should have first for yourself is love yourself first. Don't put yourself the last on the ladder. Don't. Because I was telling someone one time, I said it took me, I think the last time I had good sleep was when, just before I married. Ever since I married, as I don't think I've slept 5 hours straight. Even in that sleep, you're already thinking of the food that your husband will eat. You are thinking of so many things. So even the sleep cells, you are not sleeping it well. Why won't you have stressors? Why? Because we can't even remove our mind of it. Even till now, that even all the children are bothering me. My children are in Canada. They don't even care. I don't know about that. It was very funny. Because we know this is 3 a.m. Nigerian time. And you are calling me just to tell me that somebody in the boss looking to summer. What is my business with that? And these days, I started becoming more like selfish. Please be selfish in it. Be selfish in it. Love yourself. Because if you die today, somebody else will replace us.
Thank you all so much. Thank you. I think the last thing, thank you very much. Thank you all so much for staying till the end. I think the last thing that I'll just quickly touch on, nutrition, Tracy mentioned it is, taking away shame and stigma. We need to be able to, know that there's nothing to be ashamed of. Fibroids is not happening to you because of what you did. So don't be afraid to talk about it. We need to begin to normalize things. Don't let, again, I repeat it, don't let anyone gaslight you. Because you have fibroids, they should not tell you that you can't have children. I know plenty of people that had fibroids, that have healthy children. I know a lot of people that their fibroids was growing and their baby was growing, and they were able to, carry both together. Do you understand? So please, enough of, shaming, enough of the stigma. Thank you very much. I want to say thank you to Rotary, District 9112, and to you all for making this a huge success. Thank you.
Good afternoon once again. I'll close this section before I call on my club president to give us a vote of thanks. I would like to say this, and I'll say it in vernacular. With all that we've said today, first of all, let he that have ears, let them hear. That's one. Number two, my grandmother used to say that anybody that said they should not laugh at her or him, they will cry the person. So with these few points we've had, we have the option of choosing what we want for ourselves, whether as a man, whether as a woman, whether as a child. It's your responsibility to choose what you want for yourself. And please, I want to appeal to us that this program was organized by my Gynecology Foundation in collaboration with Rotary District 9112, Rotary District 9112, and the Rotary Club of Ajago. So it's a joint project, and we're so excited to have everyone present here today for this event. And in fact, let me give you an hint now. Somebody is already begging that the video of this program, she was here, and she said, I don't know why Rotarians did not come out. So I want them to please post it on Women in Rotary Club, and I told them they will pay for it. I said they were going to pay for it because knowledge is not cheap. So when we decide to give you free knowledge, grab it with all efforts. And I want to say thank you to everyone that stayed to the end. And on this note, I'd like to call on my club president. I'm always proud to call him my club president. He has been here since the very beginning of this program. Just give us a short vote of thanks while we call it a day. I will not fail before my president began to but David Duncan. Please come forward. And please also say thank you to Rotary Actor the district Rotary representative for staying all through. Thank you very much.
Good afternoon, everyone. Good afternoon, everyone. I hope we enjoy the various sessions that we had today. I know that we had a few men that were here. Primarily, people thought it was for women. But I always say, as far as gynae issues are concerned, the women cannot do it alone. The women need supportive men. The men could be brothers, the men could be husbands, the men could be friends. But they need men because we are all in it together. Fibroid can be quite challenging, but I also know that with the right care, and especially if you notice it early enough, something you can resolve. So just for us to take care of ourselves, like everyone has said, get the right medical support. Even when you are pregnant, I know that my wife had fibroid when she was pregnant, and because we had the right care, some other people would have been worried, but we were never worried because we knew we had the right care and we had to see the doctor every 2 weeks. And with that, she carried the time or full time. So let's do what we can do and make sure that we are fine. I want to thank Rotarian Bonyekon, our very own Rotarian Bonyekon. Thank our foundation as well. Thank the district. The district governor, Rotarian Landry, has been very, very supportive with the right leadership. And then the retractors around as well. You know, Rotary without your energy is almost zero. A lot of us discover Rotary in the university. So I know we cannot do Rotary without retractors. So thank you for all you do. And to everyone that came, please, thank you. We always, this event is, we always have it often enough. So whenever there is another program by my gynae issues, please find time to come around. And I wish everyone a wonderful and safe journey back home. Thank you. As a Rotarian, we will just take the rotary dress. We'll write as we take the rotary dress.
Say thank you to everyone. I want to appreciate the whole line of advisors from professional